morning, everyone. Good morning, everyone. I can see energetic faces today. So, welcome back to the One Health Summer Course 2026. Today is the second day of our lecture session. I hope you have a pleasant rest yesterday, everyone, and ready to learn again today. I also want to greet our friends who's joining us online. Hope you are all still excited, even though you're following it online, everyone. So, yesterday, we have built a stronger foundation of One Health and the importance of digital innovation to actually implement One Health. And today's session will focus on two themes. First, animal and livestock surveillance, and the second is wildlife and forest interface. For this morning session, we already have our three outstanding speakers here with us from Universitas Gadjah Mada Indonesia, from University Malaysia Sabah, Malaysia, and Auckland University, New Zealand. We really hope that today's discussion will further strengthen our understanding of the interconnectedness of ecosystem health, wildlife, livestock, and human health. Now, without having to wait any longer, we will start our morning session that will be led by our third moderator, Dr. Alvin Harjuno Dwi Putro, Master of Science. A brief introduction about Dr. Alvin. He is a lecturer of Department of Parasitology, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. He is also a member of the Monitoring and Evaluation Team, Master Program in Tropical Medicine, Universitas Gadjah Mada. He is also conduct research on parasitology and vector-borne disease, including scabies diagnostic and insecticide resistance in Aedes mosquito. So everyone, please welcome Dr. Alvin. Time and stage is yours.
Hello, good morning, everyone. I'm Alvin, and thank you, Miss Catherine, for the introduction. So today, without further ado, let's start our first discussion with Dr. Bayu. Thank you, Dr. Bayu. So our speaker has joined us here. Okay, so I would like to read short resume for Dr. Bayu. He's an assistant professor and researcher at Department of Biostatistics, Epidemiology, Population Health, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada, Indonesia. He is expertise in epidemiology, infectious disease surveillance, maternal and child health, health system strengthening, and outbreak investigation. He is also a contributor to epidemiological studies on COVID-19, wastewater-based surveillance, measles, rubella prevention, chikungunya, and foodborne disease outbreaks, and maternal health care improvement. So, okay, everyone, please welcome our first speaker, Dr. Bayu. Time and place is yours.
Okay, thank you, Dr. Alvin. Good morning, everyone. Okay, so today I will talk about One Health related with human, animal, and environment with a case study based on anthrax outbreaks in Indonesia. Okay, because we have limited time for the presentation, so I just go through the presentation. Okay, wait. Okay. Wait, sorry. Okay, so today we will talk about the human-animal environment interface. It's the connection between these three that build the One Health paradigm. So we know that in One Health, we have like philosophy regarding that the health of people, human, is related with the health of animal and environment, because in our daily life, we also have connection with animal regarding what do we eat, and then about regarding the workplace because we have livestock, and then we have farmer, and then regarding environment. So these three is has a quite great connection, and then whenever one of these three is one of the component from these three is disturbed, so having a disturbance in one sector, for example, we have an environment that being neglected, or maybe the animal side there is no surveillance, and then there is no monitoring regarding the animal or livestock travel between each of the districts, or maybe from the human side there is a change of behavior where we neglect or we didn't pay attention regarding the health behavior in our side, and then in that case there will be an increase of a case related with one health disease. In this case we will talk about anthrax. Tidak mau. Okay, so this is okay. So this is the one that we will talk about because One Health is quite many. So it's not only anthrax. So we have also leptospirosis. We have also rabies, but this one is relatively close to Yogyakarta. Other than leptospirosis, we have several outbreaks in one of the districts in Yogyakarta. So what is interesting in Bacillus anthracis is that it's quite resilient. If it is in the spore form, it have quite high resilience regarding the change in environment. And then so whenever it sense a danger and then it's form a spore, then that's when we have quite a problem to eradicate this Bacillus anthracis. And then it's usually a soil-borne reservoir, so it stay in the soil, and then it can contaminate human or animal that contacts with the soil that already being have the Bacillus anthracis. Because of that problems, and then combined with the biology persistence of the chemistry of the soil, and then we have quite high rainfall sometimes in some of the season, it could also increase the possibility of the infected soil to move the anthrax spore from one location to another location. So that's also one of the problem in Indonesia. We have quite a high rainfalls in some of the season, and then there is also topography in one of the district in some area. Usually in anthrax, what makes it quite difficult is that the topography in the area that has been there is an outbreak, it become difficult because there is a high, quite challenging topography because it's like upland. So it's like they have high ground and then there is a lower ground. So then combine that with the contaminated soil and the rainfall, the possibility of the movement or the mobility of the anthrax spore from one location to another location, especially from higher ground to the lower ground, is quite high. And then because of that, because of those two, the pathogen environment and combined with the human, it's not a big news that changing human behavior is quite difficult, and it's also one of the example that we are going to
Recording in
see
progress.
in one of the case of the outbreak, that changing the behavior of a human is quite difficult whenever it's involving socio-economic factors. When there is a socio-economic, especially the economic factors involved in there, changing human behavior become quite difficult because they usually will prioritize economic rather than health side or health sectors. Combined with that, with the resilience pathogen and the quite dynamic environment with the challenging human behavior, that's make anthrax become like endemics, or maybe will be another case followed by another case in every years because of combination of these three and the disturbance between these three. Usually the disturbance made by the pathogen or the human. Usually by the human, because usually it's introduced by people who trade livestock, but through vectors without proper monitoring, and then these livestock they are infected by with the anthrax, and then due to economic condition, we can see that there will be one behavior that could transmit anthrax in the entire area. Next. Okay. Yeah, so usually it's moving like this. From the soil, it will contaminate the livestock, and then because without proper monitoring or proper surveillance in the livestock, so then, and also we don't know which soil that has been contaminated with anthrax, so we don't have like a good detail mapping of area that highly possible of having anthrax in the soil, except for those that already have an outbreak in there. But for the area that didn't have any outbreak, so we don't know whether there is a quite high risk area for the soil. But from there, the spores will contaminate the livestock, and then because there is no proper monitoring or proper health education to the livestock trader, then they will trade, and then usually it happens through a backdoor channel, which means that it doesn't happens in a proper market of livestock. Usually they trade individually through some broker or trader, one trader to another trader, and then because of that, then there will be a spread of anthrax. Okay, so the primary drivers that we are going to see is, other than topographic and the livestock traits, there is also a surveillance gap, which it happens in both sides, in human and in animal side, and also in environmental side. So we still have quite a big challenge regarding surveillance and monitoring of anthrax, and then also the other one health like lepto and rabies. And then there is also mismanagement of the carcass from the livestock. That's also related with the human behavior. And that's this one of the primary contributing factors that makes anthrax become highly transmitted in the area. So in one of the district in Yogyakarta, and maybe in other area, will be a different name. So there is a name, we call it purak, which is slaughtering a sick animal, because they afraid that if they let it dead due to sickness, then the value will be decreasing. So that's why they have an urgent slaughter of a sick animal to at least they can salvage the values by selling the meat and the other by cheaper than the usual because it's sick. And then there is also brandu, which is a ritual of communal, which is they similar, they slaughter the animal and then they give the meat to the community, to the people in the neighborhood. And if the animal is healthy, it's not a problem. But the problem is because it's occurred in the sick animal. And in Indonesia, anthrax usually happens in cow, and cow is having quite it has a high price, so it's like around 30 millions above. It can reach 50 to 100 million if the cow is very good, in a very good condition. So that's why when the animal is sick, they want to at least save some of the value. They don't want it to be like getting zero value from the sick animal. So that's what makes purak to be happens in the area. Yeah. So, and about the brandu, so when there is a farmer's cow died, then the neighbor will collect money to compensate, and then they will trade it with the meat from the sick animal. It's not a bad behavior, but the problem is anthrax transmit through this way. So through if they change the carcass, the meat, so it increased the possibility of having infected by anthrax. So that's why one animal deaths, if it's connect with the proper behavior, bad behavior of human, like this one, it becomes a community-wide exposure, because then all of the community, they are exposed with the anthrax. From one animal, they will expose whole the community. And then that's what happened in the case study. Okay, so we go through the case study. So it happens in around 2019, the first one. So there is a first human anthrax case reported in village K. And then there is another case in village A, B, and C through Brandu tradition. And then in January 2020, there is a death of livestock. And then it is investigated in village C. And then in January 2022, there is anthrax outbreak with 39 human cases. And then it followed by in December 2022, in different villages, there is 11 suspected case with 11 seropositive, but there is no severe symptoms. And then it shows that the village is near each other. It shows that the environment play a role in here, and then there is also human, because the human behavior through Brandu, through the gaps in the surveillance that we already know in 2019 that there is a human anthrax case near there. But there is no improvement of surveillance, then it goes in human and animal, and then goes down to the village D outbreak, which is 39 human case. So 39 from 277. The attack rate is around 14%. It's quite high. And then, so if we see how the outbreak unfold, how the case spread, that it start with one of the villager cow, it's become sick, and then when they know that the animal is sick, and then they usually already know that this is anthrax. So that's why before the government or the district office come and confiscated their animal, so then they start to do the slaughter. And then they do it without a proper protective device, without protective clothes and others. So they just do it like usual without any protective device. 4 people cut the meat and then packs into 65 packets of meat. It distributed to the 63 people. And then as we can see, there is a first 4 patients with anthrax symptoms seek care at Puskesmas. And then after that, there is an investigation. And it shows that it becomes an outbreak, because then it's increased into 39 cases. And then there is a mass treatment, blood sampling, and they also look for the sample from the meat that hasn't been consumed, and then they confiscated all of the meat, and then they also track down where the location of the slaughter, because we need to know and mark the area that the slaughter being done, to make sure that there is no one got near there and then test the soil whether it's already contain spore of anthrax or not. If you can see, most of them is young adult, and then there is also children around 14. Most of them is the young adult is a farmer, and then because it's already being distributed to the community, so then we can see there is a child case that belong to the less than 5 years old and around 6 until 11 years old, because it's already being distributed in the community. And then because they know that the meat is probably has a disease, but they still consume, because having a cow meat is quite in a cheaper price. It's quite a privilege in that area. That's where the socioeconomic factors affecting. Because if an area it doesn't have any problem with socioeconomic factors, so there is no problem with economic, so then they will not resort for cheaper cow meats when they already have a good economic status. This happens because they have a quite not a good economic status. So when they get cow price that usually maybe around 50,000, then but they only need to pay around 10,000 to get that meat. So then they choose to get the meat and along with the risk, and then this happens. And then it occurs like this. So it happens like we call it in epidemiology, it's like common source, because we have a one peak of the epidemiology curve. It happens after the brandu, which is after the slaughter, and then it's because from one source, one cow meats that spread to the community, so that's why the peak is only one. After the meat is taken by the government and all of the meats is taken and then they dispose the meat, the case is stopped. There is no another additional cases from this village. And then most of them has a fever, is a similar symptoms in anthrax. There is also skin bully and then under itching. Some of them have diarrhea and reddened skin. And then this one interesting that as we know that in anthrax transmission, human behavior is one of the key factors, and then we can see that just holding the meat, it's not necessary to involve in the brandu, just get the meat itself have a increase. So people that hold the meat or get the meats without involving in the brandu, they have risk of increase of odds becoming anthrax case 6 times higher. It's quite similar with the brandu, which is people that involve in the brandu, they have odds 5.9 times higher to become anthrax case. Why is that? Because when they transfer the meats, when they give the meats to the community, they didn't properly wrap, then they properly clean the meats. So that's why it increased the risk of transmission in the community. Then how can we close the loop? We can close by conducting proper investigation. So because we know that anthrax is resilience in the soil, then we need to test the soil near the brandu area and then soil from the where the cows is being held. And then it tested positive. And then the location of the cattle pen where the sick animal is located sits in the downhill from the brandu side. So this is a different cattle. And then so because of the brandu is in the higher ground, and then there is a rain following the event, so that's why they test the soil from the cattle pen downside from the Brandu area, and then it tested positive. So that shows that rainfall, it also improved the risk of moving of the anthrax spore from one location to another location, because the Mr. N's cattle pen, it doesn't involve anything at all in the outbreak. But then the soil is tested positive, and we suspect that it's because it is in the downside of the Brandu area, and then there is a rain after that event. And then fortunately, the teams know that the cattle shows any clinical sign, and then it were treated. And so that's why they mapped the area that tested positive for Bacillus anthracis, and then create a marker to notify people around the area that this area of soil is tested positive for Bacillus anthracis, because we cannot use that soil anymore for another 10 years or more. And then there is also laboratory confirmation to confirm this. And then there is another one in a village not far from there in December 2022. Fortunately, there is no clinical case. There is only 11 seropositive case. And it is also involved with human behavior that wait, it goes to the beginning. Kok balik ke awal? Kepencet. Bentar, dari mana? Sorry. Okay. So it happens because there is a tradition of the 1,000 day commemoration of one of the people that already died, and then they slaughter a goat, and then there is also they slaughter and proceed communally, and then there is no sudden animal death. But then we found that the soil, there is a 11 to 17 samples seropositive of anthrax in the patient, because there is a single patient that present with non-healing lesion because they have diabetes. It's first mistaken for diabetes, but then it tested for anthrax. It's quite different between these two outbreaks. Why? Because at the first event, the trigger is quite high risk event with this Brandu. We know that it's a sick animal. They slaughter without any proper protective device. But in the other one, the goat is slaughtered in a proper protective device. So that's why there is no high risk transmission. And then there is only small scale of event. It is commemorating 1,000 days of the grandmother's died. But in the previous outbreak, after they slaughter, they give the meat to the whole community near the Brandu area. So that's why it's become bigger than the second outbreak. The first outbreak is bigger because it contains a high risk behavior compared with the second one, especially the Brandu. And then how do we control anthrax based on the case study? So we can, based on this, we need to learn that when we conduct outbreak investigation of anthrax, we need to do an active case finding, door-to-door tracing people who receive the meats or people who involved in the slaughter to find every possible cases in the area. And then we treat, and then we do a multi-source sampling, not only soil, but we also collect from the human. And then dispose the carcass and meat in the proper area. And then make sure that coverage of the livestock vaccination is high. And that's also, this part is part of the animal side. And then there is also environmental control. And then, because we know that anthrax stays in the soil, and then that's why we need collaboration from the environmental side. Because in this case, in the anthrax study case, it's not only human that should be involved, but also animal and environmental, because we know that human side, the human doctors, they cannot do the vaccination to the livestock, and then they cannot, and from the human side, they cannot do the monitoring of the environmental, the soil, to the formalin spraying and the others, because it's not, they are not equipped with skill regarding that. So that's why we need the environmental side for this one. So that's why by improving human health, animal health, and environmental health, we can have a good control of the anthrax. And regarding the behavior, we need to break the brandu. But it's quite difficult. The government itself, they already try to create like replacement money for livestock that get sick, but the number, based on the interview with the community, they say that it's still, they still think that it's cheaper than what they think that they will get regarding the sick animal for the replacement money. But then what can we do? We can still educate them that at least they can still get the money by delivering the sick animal to the government, not slaughter by themselves. But it's quite difficult because the price of the cow is quite high. So when one farmer had their cow sick, and then they only get replacement money, they know that they only get small replacement money, then so that they think that it will be better to, or similar with the one that they will get with the true brandu, then it means that they can, for them, it's better to do the brandu because they still not having a good acceptance regarding the program. So that's why it's quite hard to break the brandu cycle, because we need to do a comprehensive health education, and then we need to make sure that they know the risk of the anthrax is quite high if we do the slaughter with that protective device. And then the other things that also important is vaccination for the livestock. We need to maintain the vaccination, the coverage, and then also monitor the movement of the livestock, because one thing that quite difficult in surveillance of the animal side or the monitoring in the animal side is livestock movement controls. Because in Indonesia, as we know, we have quite many backdoor channel or informal trading route, because there is so many road that leading to one area. So it's quite impossible to guard every road in the area regarding to monitor the livestock movement. So that's why it's quite difficult to monitor this livestock movement control, because there's still the illegal trader, they can still find a way to avoid the monitoring from the animal health teams. And then we can also educate how to safely dispose the carcass or the meat if they know that it's from the sick animal. And then also we can do health education and then combine with the culture in the area to make sure that they accept regarding the health education. But yes, one of the most important factors that quite hard to make it hard to break through the education and this remove the brandu cycle is regarding the economic from the human side. If there is still people with low economics in the area, then there is still a high risk of conducting the brandu. And then there is also high risk of people that accepting the meat from the brandu because it's cheaper. One of the most extreme things that happens, it's maybe people from Yogyakarta already know that There is a case anthrax outbreak where they dig the cow. So they already done a proper management. The cow that's sick, they bury and then they report. But before the government come, someone from the area dig the cow and then they slaughter the dead body of the cow. So that's also one of the outbreak other than this one. So why? Because of the economic factor. So it's quite difficult to break the chain if we still facing economic in the human side. Yeah, so this, as I mentioned, the environment is like a good breeding for the anthrax. So they are protected in this areas because when they are in the spore form, they are quite difficult to remove this anthrax from the soil, making the area is permanently high risk zones. And then from the animal side, monitoring of the livestock movement is quite difficult. And then having maintained the coverage of the vaccination is more difficult than maintain the coverage of vaccination in human. And then in the human side, poverty. All of the factors like behavior, the brandu, and then the pura and the other, it's leading to one important factor, which is poverty. So as long as these three still exist, we will still find anthrax in Indonesia. So then how do we do that? We can target the economic root and then the environment decontaminate and then share data between agency from animal, human, and environment. I think that's all from me. If there is any question, I will be happy to answer. Thank you and good morning, everyone. I'm giving back to moderator, Dr. Alvin.
So thank you, Dr. Bayu, for a very interesting lecture on anthrax transmission in Indonesia. I think what we learned from this session is that anthrax transmission mainly drives by three factors, which are the pathogen itself, the Bacillus anthracis, and then the environment. You know, in Indonesia here, we have tropical climate with quite stable humidity, rainfall, and also temperature year long. It's a perfect breeding spot for the Bacillus anthracis. And then I think the most challenging aspect for the transmission control of anthrax here is the human or the social and cultural factor itself, because like what Dr. Pai told, that we have local wisdom such as Brandu and Porak, which unfortunately when it does not translate into a good health practice. So is there any question from the participant? Any question? I think it's connected to the previous lecture yesterday by Prof. Tribawa, that he said that large livestock is cash money in the form of living things. So when the livestock died, the people try to salvage any value from the carcass. Is there any question? And I think for a fun fact that in the Javanese tradition, we also caught large livestock such as cattle, buffalo, with Rojo Koyo. Rojo it's king, Koyo it means wealth. So it's a symbol of wealthy. So it's will be very unfortunate even if something took the life of the livestock, including anthrax. Any question for the transmission of anthrax? Okay. So please introduce yourself and mention the question.
Okay, thank you for the interesting explanation, Pak. it is very complex issue if you talk about the anthrax that happened in Gunung Kidul. Yeah, as you mentioned that if we talk about the behavior change and if it involves the social and economic, it will be difficult because the community will prioritize the economic and social rather than health, right? And anthrax still happened, but maybe the decision maker there just only give an intervention towards the regarding vaccination and environmental, but for the behavior change is kind of not really optimal. But in my opinion, if we want to increase the health quality of the community, the behavior change should be implemented. Yeah, there is no option for not doing that. So, what is your recommendation to monitor the behavior change that has been implemented by the maybe the primary health center there or by the local government there, so that at least the behavior will change even gradually and reach the community will have an option to consume the healthy and safe meat there. Thank you.
Okay. Thank you for the question. So it's quite interesting. One thing that I learned through all of the stages of education that and from the bachelor and the doctoral, one thing that I know that changing human behavior is the hardest thing to do. In anything, any disease, any health outcomes, any health problems. So that's why, as I mentioned before, the district health office, they already try their hardest intervention. They try their hardest. They try to give the intervention regarding the health education, and then how do we keep track of the health education to make sure that it's still there? One thing that we can do is by empowering the health cadre in each of the village or maybe sub village. So one of the we can say that factors or maybe resource that Indonesia has is we have health cadres, we have PKK cadres or family cadres that we can use that to monitor the change of the health education or to give health education to make sure that the health education is giving regularly in the field by using the health cadre. And that's I think that's also one of the program the integrated primary care focusing on by improving the work of the health cadre or the function of the health cadre in the community. One of the function is by giving health education and monitor health condition in their area, because we know that if we only rely on district health office and puskesmas or primary health care, they cannot do much because they have limited resource and they must cover the whole village, and sometimes in one puskesmas they must cover 3 villages, and so it's quite difficult. So that's why the role of health cadre plays there. So in one puskesmas, it's necessary to have health cadres in every sub village or village, so that's when they know that maybe near there is the health cadre becomes their ear and eye, so they know problems earlier if the health cadre is functioning, so they will know whether there is a livestock that died or maybe sick. They will know first from the health cadre, and then the health cadre itself, they can be used as the health educator as long as they are trained and maintained by the puskesmas. So one of the most basic recommendation is improve the function of health cadre and maintain their role, and then involve them in the health programs. And hopefully by the integrated primary care program from the Ministry of Health, we can see improvement in health cadre. And then aside from that, I think the government already tried to solve the economic problem, but yes, because of the district itself, they cannot just say that if there is any cattle died, we will replace with 30 millions until 50 millions. No, they cannot do that because their budget is quite minimum for a case like that, because anthrax is not that one or two cattle. Sometimes there is multiple, so they cannot change. But at least they can offer some economic value, even though it's minimal. And but hopefully they can improve it into a more acceptable price. I think that's all.
Okay, is there any other question? Okay, please introduce yourself and mention your question.
Thanks for the opportunity, Dr. Bayu. I would like to give some question, like how we usually or ideally do surveillance environmental regarding the anthrax, like how often do we do the sampling the soil, something like that, like is it like when we only find the case and we do the sampling, or you do that regularly? And also, is it that only soil that we do the sampling, or there is any more objects like water? And the last question is how we do treat the anthrax patient, like do we do the quarantine or something like that? Yeah.
Okay, so regarding the first one, regarding the environmental surveillance, so if we talk about the best approach, of course, it's not only when there is an outbreak, but the most important thing is from the surveillance environmental is we can map or monitor, we can describe which area has the high risk or positive soil, and then based on that, we need to make a perimeter. So we know that if we know something like that, then we can create map of area with high risk of anthrax. Then we can share the data with the human health and the animal health to make sure that in the area of high risk anthrax, we need to make sure that the animal coverage is good, the animal vaccination coverage is good, and then the human behavior it's need to be improved. And then so that's one of the important things, because if we don't know, we only know from the outbreaks, so we only have the data regarding the outbreaks, so that area that didn't have any outbreak yet, we don't have that kind of data. That's also one of the downside if the environmental surveillance is not working. And then what kind of object? I think the most important one is soil, because that's the most usually contaminated by anthrax. If it is water, I don't think so, because usually they become problem like from rainfall. They help move the soil itself. So it's quite, so for example, if there is a river, so we don't test the water in the river, but we test the soil near the river, whether they are contaminated by anthrax or not, because the one that they move is pour in the soil usually. And then I think the second one, could you repeat your question?
How do we treat the anthrax patients, like a quarantine
treat
or
the- So usually we don't need to quarantine, but they need to have a treatment and then make sure that, because it doesn't transmit through like influenza, something like that. No, it transmits from the meat or blood from the animals. And then as long as we keep healthy behaviors, not so we don't usually we don't touch people lesion or skin lesion. We don't do that, so that's safe. And then The only thing that we do is for the anthrax patient is we treat them, we bring them to the Puskesmas to see whether they need referral to the hospital or not. If they have a comorbidity, then maybe they need to be referred to the hospital. If not, they can be treated in the Puskesmas or in their home. That's usually the standard things to do. They don't need to be quarantined and then in one house, and no, it doesn't have to be like that.
Oh, so they can stay with their family in one house.
Yes, as long as they pay attention to the health behavior, so they didn't change like towel when if they are still sick, to make sure that they didn't contact each other with the skin lesion or something like that. Because usually the anthrax that happens is the cutaneous anthrax. So the other anthrax, for example, that one transmit from the air, it only happens through bioterrorism. It's quite rare to happens in anthrax transmission in community. And then there is also one case of some case of anthrax through injection, but it happens only for heroin user. So it's narcotics, because the heroin or maybe the substance is they are contain anthrax, so like they are get infected through there. But the one thing that usually happens is cutaneous anthrax. It's the most common thing in there. So it's not that infectious as the other, as long as they didn't contact with they didn't involve in the brandu, or they didn't hold the meat or process the meat with a protective device. If they process it well, it will reduce the risk.
Thank you.
Okay. We have one question from the two questions from the participant in Zoom. Could you show it? Okay. Participant from Zoom. Yeah, please, if you have. Okay. Please introduce yourself and mention your question. Okay, hello. Sundar Satar, right, from Pakistan?
Yes, I'm from Pakistan. Sorry, my name is Sundar. I am from Pakistan. First of all, thanks so much for this wonderful opportunity. It's an honor for me. Thanks so much, Deepak, for your time and wonderful presentation. My question is from a One Health perspective, how can we culturally informed education and behavior science be used to increase farmers' trust in livestock vaccination and encourage them to view it as a long-term investment rather than an additional expense? Thanks so much.
Okay, so as first of all, sorry if I cannot catch your question clearly. So I think it's related with the implementation of One Health. How do we improve that? So in order to do that, we need to know. First of all, we need to make network between these three agencies, which is the environment, animal, and the human health. In Indonesia, we have one database that connected through animal surveillance, animal health, human health, and then environmentals. And then there is also after we have the network and the database, we need to have a regular meeting. Of course, we need to have a regular meeting, and then we need to have a regulation also, because I think in other country as well, in Indonesia, a regulation that holds the One Health is one of the most important things, because without the regulation, the agency usually they will not treat One Health as an important one. But if we have a regulation that state One Health must be held by 3 agency, and then these 3 agency must share information each others, and then other things like surveillance database is managed in this regulation. When that happens, we will have a good implementation of One Health. So, but then I think that's from me.
Thanks so much, Professor, for your answer. Thanks so much.
In Zoom from Solangiados in Timor-Leste.
Yes. So the most cost effective, of course, we need the intervention is by we need to know which soil is first. We need to know which soil is has positive of Bacillus anthracis spore, because by doing that we can minimize the contact from livestock like cattle to the soil. And then the second one is if that's not managed well, so it's if that failed, the other one is by conducting animal surveillance through the animal movement controls. So to minimize, because we need to minimize the movement of sick animal. That's if it is cost effective, yes. Is it harder? It's hard to implement, but yes. It's cost effective, but it's hard to implement by monitoring the travel, the movement of the livestock. Because if we can monitor effectively, and then we can make sure that sick animal didn't transfer from its country, from its district to another district, one district to another district. And then the other things is maintain the coverage of anthrax vaccine in the animal. And another one, so we need to do it in all of these 3 aspects. In human, the most cost effective is, of course, health education, but it's the hardest to implement. Another cost effective after health education is by doing a replacement cost, like the one that being done in one of the districts in Yogyakarta. They give replacement money for the sick animal. That's also one of the cost effective, because of course, if it can be cost effective in area that the anthrax is not endemic, or maybe not that many, but if it is many, health education still one of the most cost effective intervention, because by doing health education we improve the awareness of community. So when they know there is a sick animal, they will report, and then it will be treated as early as possible to make sure that it doesn't spread. And then if the community is aware, they will not do Brandu, or we will minimize the number of people involved in the Brandu. So then the number of casualty or number of case will be minimized. I think that's from the all of the 3 aspects of One Health.
Okay, thank you for the lecture, Dr. Bayu. So I think we still have one more question from the Zoom, or oh, okay, sorry, from offline participant. Okay.
It's a short question.
Yeah.
Good morning, everyone. My name is Mahathir Omar Fahad. I'm from Bangladesh. My question is, I would like to know your perspective. I'm talking from Bangladesh perspective. There's a recent anthrax outbreak in late March this year in Bangladesh in a border area. So what we have observed that most of the rural farmers rush to slaughter and sell the meat from the sick cows, cattle, actually, to avoid their financial loss, which we can assume that causes anthrax outbreak. So my question to you is, what do you think the government should have, or the government, is there any contingency, especially financial contingency plan, a government should have to minimize the financial loss of the rural farmers? Do you have any recommendation on that? Thank you.
Yes, thank you. So yeah, that's, I think, happens also in Indonesia. So then one of the things that we can do to minimize the financial loss is to have first we can have the finance replacement money from the government, and then if the number is not enough, then we can have, like, for example, community fund, because we know that if it's, especially if the area is like an anthrax outbreak, so we can create a community fund to help support the replacement money from the government. But this must be done by the government and the community itself. It cannot be done by the community itself. So if the government, usually they have limited fund, but they have the fund, so then we can add the fund by using community raised fund to supplement this government finance replacement money for the farmers. I think that's also one of the things that we can do, because yeah, economic factor is one of the hardest thing. If whatever we do about the health behavior, do not slaughter the sick animal. It's similar with, like, if we have money in stocks and then the stocks plummet, so the number is decreasing, then we try to salvage no matter what is the consequence. That also happens in farmers, because cattle, cow, is the number is quite high, the value is quite high. So then what we can do is we offer them replacement money, and if it's not enough, then we can create a community fund, and then hopefully by having that and by having a good health education, we do that regularly, get health education and having the replacement money. Hopefully in the future, we can make sure that the minimum number of money that we can offer is still quite good, because it's compared with the health risk that they can do, and that they can create by slaughter a sick animal. So then two things must work: replacement money and then improve health education to change the behavior of the farmer. We cannot do the health behavior itself. We still need the replacement money. Even though it's quite minimal, we can try to supplement with the community raised fund. I think that's my opinion.
Okay. Sorry, but unfortunately time is up because Dr. Bayu has a trip to Jakarta, so he need to catch up. Maybe you could send your question to the email. Our email, we will forward it to Dr. Bayu. Yeah.
So we are working on the behavior and each and everything of cow. Thank you so much. Hi guys, I'm from Pakistan. Currently, I'm pursuing my PhD in MECOM University. So one of our topic is like animal intelligence system. We are working on sapi cow. We are working on like 4 to 5. One is like surveillance system to know the weight and health of cow, and then we have to seed or we can diagnose what diseases are suffer from. So like the question is pretty simple. Like some sort of farmers, they suggested us during the trips when we went there to visit the castles, and they were like saying that we need to check the behavior. So how would we know the behavior of cow? So I mean, like if I'm sick, let's suppose if a person is sick, he pretend to be fit, but how we can know the behavior? So initially we cannot determine. So let's suppose I'm a new person who travel from Pakistan to Indonesia. So I start getting the system. How should I understand the system? Like how the cows getting sick. I mean, I'm familiar with the Pakistani culture rather than Indonesian. So I just need some comments.
Okay, so it's a little bit. So you're asking that how the cattle get sick, or how the behavior of the cattle.
Yeah.
The behavior of the cattle. Okay, so but first of all, I'm not a veterinarian, so I don't know exactly. But when we see the AI era, I think it's quite a good things that we now entering the AI era. So one of the things that I can suggest is that by having collaboration with a veterinarian and then with a local farmer that have a cattle, cow, or other things, other animals, then you can study the behavior and then model it using AI. Then by using that, maybe we can use create a machine learning. Then we can predict if the behavior of the cattle is like this. Then maybe it's a high risk of possibility that. So it's similar like predicting the behavior of a human with to see whether he is faking symptoms or not. So I think that's the most thing that I can think about by using AI. So AI is thing that we must grab, not we must fear.
Okay, thank you for the question and thank you for the explanation, Dr. Bayu. So we now have reached our final session of the first lecture today. I would like to thank Dr. Bayu for delivering such an inspiring lecture on the anthrax transmission and how to prevent it in Indonesia. So let's give our last applause to Dr. Bayu.
Terima kasih.
Okay, so we have a souvenir for Dr. Bayu. Maybe take a picture. So after this session, we have coffee break for 15 minutes. So please enjoy the coffee, tea, and your snacks, and we'll meet again at 9:55 here. Hello, everyone. Do you enjoy the coffee break? Okay, so after the coffee break, let's go into the second lecture by Dr. Afendi. Now we are shifting from disease epidemiology. Now, Dr. Afendi will deliver a lecture on agriculture. So this is the resume of Dr. Afendi. He's a Deputy Dean of Research and Innovation in Faculty of Tropical Forestry, University Malaysia Sabah or UMS. He is a senior lecturer with over 15 years of teaching experience and head of the UMS Forest Silviculture and Protection Research Group. He's also a recipient of numerous national and international awards, including the silver medal at INA Nuremberg, Germany 2023, gold medals at ITEX and Pecipta, and the Sabah State Top 3 Technologies Award in 2023. He is also the founder president of the Malaysian Society of Agroforestry or MySAF and commission officer of the Royal Malaysian Navy Volunteer Reserve. So give your applause to Dr. Afendi. The time is yours.
Thank you, Dr. Alvin, the moderator and chairman MC for today. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And very good morning. So first of all, I would like to thank to the, especially in Fakultas Kedokteran, UGM, for inviting me to be here to share something about related with the forestry. So actually, this is not my first time to come to UGM because since 2021, I was invited by Fakultas Kehutanan UGM since 2021 to give the same summer course. But this is my first time to deliver this sharing summer course in Fakultas medical faculty. So this is my pleasure to be here. So within 40 minutes, I guess, I will share the. I'm not talking about giving lecture because this is like more discussion, yeah. So I guess you here in the audience have the different backgrounds. So from if I can see the title of talk today from animals and just now, and now we're talking about forestry. So even we are not learned about forestry, we know that the trees very important. We planting trees surrounding the home, and scientifically when we learn how it's work and how the mechanism, that is more in that knowledge. So yeah, thank you very much for the introduction just now, but I'm really worried about the last part of the introduction about the Navy. So maybe it's a bit sounds weird because why this academic or lecturer involved in the Navy? So maybe it's quite different from other country because we in Malaysia, they even you are doing US1, they encourage to involve in you know, like a uniform society, yeah. So never mind, it's not important. So the important today is we are talking about the title given to me to talk is about urban ecology and agroforestry. So and how we designing the healthy cities, yeah. So please interrupt me if you have any question. So I don't really like just one-way conversation, yeah. So I'm happy if you have question, want to clarify, just please. So yeah. So the title is, in general, is about the forestry, yeah. So how it's work? Okay. It's slowly. Okay. Hey. Okay. The content of my presenting today, it's now we want to define first the urban ecology, and then a bit explanation about the urban ecosystem services, and urban agroforestry systems, and how we evaluate the benefit of urban green infrastructure, and how we propose healthy city design strategies. Yeah. So next. So the urban cities and why cities need nature. So we cannot deny that today's all over the countries they try to create more building, more towers, the highest towers in the world. Yeah, and then they create more actually dangerous to our land. Yeah, this is nowadays looks, and this is related with the previous topic, and the people were talking about the climate change. So the climate change is not the new topic. The people already talking about this the decades, and then this is many factors, underlying factors, causes for this climate change, and one of them because of the deforestation. Yeah, so many causes, and this is also related with the political intervention. If we we have the government, and then at the same time we think about the people, so that they get maintained in the political, in the government position. Yeah, some people they talk, oh, we need the land, we need to expand the land for the consumption, for the agricultural land, especially in Malaysia. We are we are oil palm producers after Indonesia. Yeah, long time ago it's Malaysia, but then Indonesia is huge land and become more the primary oil palm productions, and of course with the price. Yeah. All right. Now we look at the global urbanization trend. Yeah, you can see from the graph the trend from 1990s to now, how the urbanization accelerate in the different countries, rapid industrialization in Asia especially, and expansion of an urban region. Then the urban population, yeah, then cities become the dominant and habitats, and then the shifted from simply building cities to creating healthy, resilient, and viable, livable cities. So why? Because now we are more talking about ESG, environmental sustainable governance. Yeah, because we have the 70s SDG. What including in the SDG, for example, the food security, life on land. Yeah, so many things. So now everywhere, if you go, they will ask about the ESG. What the element ESG? Yeah. So we learn from the COVID-19, for example. Yeah, many what we call industries that affected. For example, I give example from pilot. They cannot work, they cannot move, and they're selling burger. Why? Then the food it's become important. Agriculture. Then we move around the route, and then the front liners there, the police and the army, yeah, block in the routes. If you are supplying food, you are simply go. That's important for the food. Then we as consumers, we have to buy the food, and then with the limited movement, buying the groceries. So meaning that the agriculture input is very important, the food. Whatever you talk in what? In the building aspect, in the transportation aspect. they come back with the food, yeah, in agriculture. So this is the balance when we talk about the development, yeah, development that we can consider. I remember a colleague from Fakultas Hutan, the lecturer said that we have a huge land of paddy field, but they're still importing the food. We're still importing the rice from Thailand. The same case in Malaysia. Yeah, because the expand population. Yeah, I can't remember the population, but then this is, you know, it's stress to the land expansion, even the school, for example. Many people, they wanted to send the children to the best school. Yeah. And imagine with the huge number of children in the class. Yeah. So we can see many examples. Yeah. Right. Okay. This is the major urban challenge emerging alongside the urbanization. Yeah. So from housing infrastructure in early 1990s, 2000 traffic congestion, yeah. The same case in Malaysia as well. The bad traffic in the big cities, for example, in Jakarta and other cities. The same case in Malaysia as well, in Kuala Lumpur and the big cities all over the world. Then climate change, yeah. Climate change, it's a big topic that you can simply Google search of Gemini or ChatGPT. And urban resilience and healthy cities. Now we come back with the healthy cities. So what the meaning that? And nature-based solution. So if you heard that it's like cities in the forest. Yeah, cities in the forest. Why? Very simple. We can imagine that if we stand in the open area outside with the, you know, with the hot sunny and very hot, yeah. But if you compare, if you're standing in the forest, then you feel cool because of the plant. If you're planting the trees, yeah, they absorb the carbon and then they store carbon in the trees, in the trunk, in the roots, and the leaf as a carbon sinks. Yeah, very simple. So they absorb the carbon, CO2. So this is become interest topic, healthy cities. Yeah, because of the, as I mentioned just now about the sustainability element, ESG governance. Yeah, right. So this is the urbanization in Southeast Asia. We don't go any countries. This is a very you can see the development or urbanization all over the world. For example, in Kuala Lumpur and Bangkok, Manila City, Metropolitan, Hanoi, in Jakarta. So the issues because of this rapid land conversion. For example, if you come today and you come back after not a few years, just come next year, then you can see the change landscape. Yeah, that's because maybe because the human made, but we remember that also become of the natural disasters that we don't know. For example, recently what happened, a small earthquake from Manila and affected in Sabah. So if you heard about that in Mindanao Island, yeah. So nobody can expect the warning from the ocean. Okay, tomorrow there will be the earthquake. Yeah, and flooding. So we have the track like annual or within 10 years period or 20 years period for the flooding. And then, of course, the government prepared for the how to mitigate the issues by the flooding, for example, and how many affected and how many people will be die because of the flooding. And this is because the environment. And we remember this is also because of the how we develop the land or the cities. Yeah. And heat stress, of course. Heat stress, the people just sitting in the building, doing their laptop and doing the work. Yeah. And how much the energy they use for the aircon, for example, the lights. Now, the countries, this is about also with the energy. Yeah, the energy. And now many building that we can see, they generate the power from the solar energy and loss of the green space. So very simple. This sounds like very simple, but it's sometimes it's difficult to translate, especially when we talk to the people that don't really understand about the sustainability. Yeah. Yeah. Okay. This is urban crisis. I think that very simple that we can see from this slide. Climate driven urban stress, urbanization, and climate feedback. Yeah. Then also related with environmental. So we can see that many cars, the traffic jam, all people wanted to buy cars. Yeah. From the cheapest car to the expensive cars. Yeah. And we can imagine how much energy and then also how much pollution that they created by the cars. Yeah. So, yeah, then we always remind that we just use the public transport. Maybe in Europe countries they're more convenient with the public transport like train. Yeah, for example, and when I was in Denmark, the bicycle it's expensive, but the car is more expensive than that. Then nobody can buy car. Then what option you have? You go to the place by bus and commute. So this is the example how the European countries this is indirect strategies so that the people more to use the public transportation because of the environmental issues. And of course, the biodiversity decline in urban areas. Yeah, I give example. One incident last year, it's about elephant. Yeah, I talk in Malaysia about Malaysia. If you remember, it's happened during the Mother's Day. The elephant with her small baby elephant was hit by the lorry and died. And from the ecologies of elephant, that actually the route for the food, but actually it's the highway, and somehow it's die. And the elephant mothers just waiting until the morning because the baby of the elephant was hit by the lorry. Yeah, you can imagine. But then actually that's their route for the food, for the feeding. But somehow the people, or maybe, yes, for us, is the human mistake, not consider about this wildlife needs. Yeah. So that's why what happened now? We create the corridor for the wildlife for their movement. Yeah. For example, elephant in the Borneo Island. Yeah. So that's why we have the head of Borneo. Why? So the elephant belongs to Kalimantan, belongs to Sarawak, belongs to Brunei, belongs to Sabah or Malaysia. Yeah, they move. They don't care they are from Sabah or they're from Kalimantan or from Brunei or Sarawak, but they are on the same island. So this is about wildlife that we need to consider when we try to develop any development the cities. We cannot deny that, but we need to balance that. Yeah. So public health impacts, urban social stress, human nature disconnection, and combined ecological social crisis. Yeah. Right. This is urban heat islands. Our UHI is the phenomenon that where urban areas exhibit higher air and surface temperature than their surrounding rural areas because due to the human activities and modification of land surfaces. Yeah, because if we open the area and we build something, then they create more heat, and at the same time that we need to plan how to control the heat through tree planting. But the very important, we need the very fast growing. If you plant the trees that very slow, then it will take many years to cover the canopy and to get more cooler on that particular area. Yeah, so this is how they design the cities. Yeah. So this is the main cause of the UHI. Of course, replacement of natural land cover, concrete, asphalt, and reduce the vegetation evapotranspiration, heat absorption and storage by building, then heat release from the anthropogenic activities like traffic, industry, energy use, and also the urban geometry that traps heat. So how they design also very important because they trap the heat. Yeah. For example, the straight canyon, dense buildings. Yeah. So later we show you when we use how the agroforestry can be used in designing the cities. This is the factor, urban densities and building height, surface material, yeah, very important as well. Either they absorb the heat or they create more heat, and the amount of vegetation cover. So the choosing of trees also important. For example, if we need to need more cover, then we need the broadleaf trees rather than the small trees. And we think also about how we maintain the trees. Yeah, and then we can see the people or the workers keep maintains the roots because of the biomass and wind speed and atmospheric condition. How to reduce the wind speed, because this also may affect by the as I mentioned, by the natural disasters. Is more wind that may affect dangerous or the building collapse or any trees that collapse and hit to the building. And population density and energy consumption pattern. Yeah. So the impact of UHI increase the energy of demand for cooling. Yeah. And his stress on humans' health, reduce thermal comfort in outdoors environment, and also the contribution to air population formation, for example, ozone, and environmental stress on urban ecosystem. Now, urban crisis that leads to the biodiversity loss. Now, we all the countries are talking about the carbon credit, carbon trading. Yeah. So if long time ago, when they talk about the trees, they just look at the yield, the timber, how they produce, they sell it, yeah, and creating more logs to fill and they sell it. That's the creating deforestation. Yeah, for example, many countries. But not only that, not because of the money, but now we think about the carbon. But the carbon is still the current issue, how the mechanism, how the pricing. But at the same time, now we talk about the biodiversity. Yeah, biodiversity. You cut the trees, but we lose the biodiversity. Yeah. Just example, if we, for example, if we do the annual crops, we open back the area, we harvest, and we put the machine, the tillage. At the same time, we create damage to the biodiversity. For example, the soil fauna in the soil, just a few centimeters. Yeah. So imagine about the big animals, the fauna, like this in the picture. Yeah. So this is about the biodiversity loss. Right. Yes. This is a driven threats of to biodiversity. So many things that I mentioned just now, it's because of many things. The climate change, yeah, deforestation and habitat fragmentation, soil erosion. So this coming up from the opening area, then create more soil erosion. A few days ago, I went to Magelang area to visit the living lab, one of the professor here in Fakultas Pertanian, and we can see the landslide and soil erosion. Yeah, what can be done to avoid that the problem? Growing population, the human, build up the surfaces, the building, cities, transportation, air pollution, pollution as well, then water pollution. This is create many things. When the increase of the population increase with the population, water pollution, air pollution, yeah. Then from this pollution, if we go to the people, then we mix with them. That's the crowd that they create disease. Yeah, some people get flu, the bacteria, and so on. And of course, the noise pollution. Yeah, that creating noise. Next, now, this is urban food security. So we still talking about the food security. For example, during the festival, for example, Hari Raya, yeah, Ramadan, and the Ministry of Agriculture or Food, they're saying, oh, we cukup sapi untuk ini kurban, for example. Yeah. So we talking about the food. We can see many sapi in the farm, but not enough, not sufficient. The same case in Malaysia as well. We're still importing rice from neighbor countries. Okay. So I got a warning from the secretary. I have to go faster, yeah? 15 minutes. Okay, this is the urban crisis. So many things, challenge of urbanization, high dependence of external food supply, yeah? Like I mentioned just now. And what is very important, COVID-19 lesson on urban food security. So with the limited land, what we can create, for example, the greenhouse with the limited space that we can produce more output. For example, the greenhouse, for example, they produce the salad, for example, without huge land, yeah. Unequal food access within cities, yeah, that's also the crisis about the food. So can cities function more like natural ecosystem? So like this that I mentioned just now, yeah. Interaction between the living organism and their physical environment within urban areas. That's the broad benefits of urban ecology. So now we can see even the people staying in the apartment, they can plant vegetable for their own consumption. Apa kalau di Malaysia dia panggil itu dapur apa? Dapur kebun lah, something lah like that. I don't know in Indonesia what they call dapur kebun dapur. I don't know. So the ministry create the idea like that. So rather than you buy to the to the grocery apa tu ke pasar, then you just harvest your vegetable that you plant in the house with the limited space, something like that. And so this is the ecology. I don't want to talk about this. I just skip. So important of urban ecology, yeah, this is improve air quality, enhance stormwater management, conserve urban diversity, and carbon sequestration. The social impact, yeah, improve public health, mental well-being, recreational opportunities. Yeah, sometimes we need the recreational activities. Otherwise, you just get stressed with your work. Like mine, I can only maybe 10 minutes in front of my laptop. Otherwise, I just walk around. Yeah. This is about the ergonomics. Yeah. Like, I don't know, in any office that they use adjustable table. Sometimes we need to stand while doing your laptop, and sometimes we need to just sit for a few minutes. Otherwise, you just walk. Yeah, that's very important. Community and engagement. Yeah, family day. I can see Indonesian here. They're very good in family day. They're very, strong with the family days every weekends. Economic importance. So many things that we can see from here. Yeah. Economic importance. Then, right. The city as an ecosystem. Yeah. I just skip this. So it's the component of urban ecosystem. There are two. In general, biotic components, yeah, humans, plants, animal, microorganism, and the interaction are biotic, the non-living components. In the simple way, the climate, the water, the soil, the air, the environment. Yes, next. Okay, what is nature-based solution or NBS? It's action that protect, restore, sustainably manage, and utilize natural or modified ecosystem to address societal challenges. Yeah. Okay, what we can see for an NBS, work with natural process rather than against them like this. Yeah. From the medical school of faculty, then we will learn about the environmental aspect. Yeah. Provide multiple benefits from a single intervention. Nowadays the people are more multidisciplinary. Yeah. Multidisciplinary from the agriculture aspect, from the GIS aspect, forestry aspect, environmental aspect, so many things. So integrate social, ecological, and economic objectives and support environment and involve green and blue infrastructure in urban landscape. Okay. Addressing climate change, biodiversity conservation, I mentioned just now, rapid urbanization, responding to the rapid urbanization, and improving human well-being. Okay, urban flooding, this is a challenge. Yeah, pollution, I think I already covered just now. So, urban forest, green roof. Yeah, green roof. That's actually we can see many nowadays. They put green in the building. Yeah, vertical, horizontal, like this, to make cooler. Yeah, like what I said, the building in the forest or the cities in the forest. Yeah. So by the WHO, it's not necessarily the cities that achieve a particular level of health, but continually creating and improving its physical and soil environmental, expanding community resources. So this is the looks like we need green at the same time. We cannot see the just gray color. Yeah. So equity, participation, sustainability, and intersect collaboration. This is the key for principle for healthy cities. Yeah, equity, participation. Everyone get involved. Yeah, for the health city and sustainability, of course. This is green versus gray infrastructure, as I mentioned just now. So I skip this. Now, urban agroforestry. So now we talk about agroforestry. So in simple word, agro means agriculture and forestry is forestry. We combine forestry and agroforestry. Yeah. So if we talk about the forestry, the people might think that forestry, we plant trees and then we had to wait maybe until I die and my next generation will harvest that agroforestry. Now we're creating same like just I mentioned that the kebun dapur. Yeah. Actually, we practice this because this is like home garden. You know, if you remember, if you stay in kampung, that we can see surrounding your home, you have what? You have goat, you have chicken, you have paddy, you have coconut, you have everything. That's the agroforestry. That's the home garden practice. So in other words, that is a combination of at least two components, trees and agriculture. Yeah, at least two, but maybe you have three. Livestock, you have chicken, you have goat, you have sapi, you have anything. Huh? You have baby, whatever. Yeah, that's the agroforestry. So we can see the combination here, the difference. I'm not go in depth on this, but we can see in the forest ecosystem and the agriculture ecosystem and the agroforestry system, they combine. So in other words, in this, actually, this is achieve the complementarity. Yeah, complement, saling melengkapi. Yeah, saling melengkapi. For example, if you can see on the picture here, on the upper layers, sometimes they have at least 17 nutrients. That's they are mobile and not mobile. Yeah. For example, nitrogen is very mobile in the soil, and the captured by the trees. And whereas the phosphorus is not mobile, they captured by that can be fully utilized by the small crops like agriculture crops. So this is the example. So I think I skip this. This is the SDG goals about agroforestry. Why? From there, the food, the energy, and the water. Yeah. This is the concept. As I mentioned just now, this is the land use type. Yeah. The various technique that you can see. So I think we just go to see the examples of agroforestry. Actually, they have a classification. They have in terms of the nature, in terms of the dominant components, and how the arrangement and how the stratification by spacing or vertical or spatial, yeah, or temporal. Okay. So in agroforestry, they had two at least. Their protection and also the production. Yeah. Okay, this is the spatial. It can be the block. It can be the interrow. Yeah, it can be by the interrow, interplanting, something else. It depends. Sometimes like this, the perimeter planting. Sometimes it's the interrow, block planting. Yeah. So this is the system. The system like the agri-silviculture means the two combination. The system they call agri-silviculture. So silviculture from forestry, agri is agriculture. So for example, if you're planting trees and you have the agriculture crops, that's called as the agri-silvicultural system. Okay, I don't go to later you can read. Silvopastoral is the system we can combination with silvo, trees, and pastoral is the livestock component. For example, you have trees and they have the cows or the trees they call as silvopastoral. Yeah, there are two combination. And the next, okay, this is the example. So this is the agro-silvopastoral, the combination of trees. The very simple, the system. Yeah, you have trees, you have the crops or horticulture, and you have also the animal livestock. That's they call as agro-silvopastoral, the three combination. So we can see surrounding. Then you can learn after this what the system that you learn from this slide. Okay. Okay, this is the explanation. This is the practice. I think I will go quickly. This is the home garden as mentioned just now, yeah? This is home garden. You can see surrounding your home if you back to your home. If not, otherwise, if you stay in the apartment that you can see this, yeah? This is Taunya system, Taunya practice. Protein bank for the cows if you plant the elephant grass that you want to feed to your cows in the kandang, for example, this protein bank. In fallows, this is common in Europe. Yeah, apiculture. If you have the madu, yeah, that you grow under the trees For example, here in Indonesia, under Sengon, under what else? The trees, yeah, under karet trees. They also the practice that. This is apiculture. So this is one of practice of agroforestry. Living fence. This is like the pagar, yeah, pagar hidup, yeah. You can use the Glyris decipium or any trees. This is shelter belt. Yeah, because why? This is for a protection from the wind speed to reduce the wind speedity. Yeah, this is more to protection. This is common also in Europe. Yeah, you can see many trees. They actually for example in Europe, there's some of the countries the flat areas. They plant like this actually just because the windy season. So they try to reduce the wind speedity. Okay, this is cropping. So you can see any practices outside the combine of trees and also any other crops, agriculture. So this is, we can see the ecological succession as a model for improving the soil. So actually it's not about the above ground, but we can see that it also can improve the soil. Yeah. System and practices, the management and how the agroforestry support food security. You can see agroforestry for food, for income, for livestock, environment. Yeah, environment, because why? The waste from the animal can be used for the agriculture, for the fertilizer, natural fertilizer for the agriculture. We can see the balance. Yeah. So this is how the forest support food security. Yeah. At least for own consumption. Yeah. Saradiri. Yeah. Saradiri. Yeah. Kalau integrated farming system and the components, I try to finish maybe just a few slides. Yeah. Case study. This is case study that you can read later on. Next. So cities ecosystem. This is final slide. So nature provides essential services, can produce food, ecological benefit, and require current infrastructure for healthy cities. And of course, future urban development must integrate ecology. So I think that's all about it. So thank you very much for your attention.
Okay, thank you for the presentation, Dr. Afendi. So from this session, we know that the urban development in many countries, not only in Indonesia, also face the same fate, that the development is tend to be more anthropocentric. So we did not think about the animal, the trees, just carried down for the sake of the development. But now we know that the development could be done without cutting down trees or remove the native animals from the environment. So is there any question for Dr. Afendi? Okay, see 3 questions, 4, okay. Please introduce yourself and your question.
Thank you. Hi everyone, my name is Ahmad Solihin. You can call me Asol. Thank you, Dr. Afendi, for your presentation. I have a question. As an expert in forestry, what is your opinion about the government that doing legal deforestation or land conversion for new capital like in IKN is Kalimantan, or a national program like national program or PSN in Merauke, Papua? Did the government considering the agroforestry system to do it? That's my question. Thank you.
Okay, your first question just now is legal deforestation, yeah?
Yes.
Okay. From my opinion, I think different countries, they have the policy, yeah? I just remember in my country, in Malaysia, particularly Semenanjung Malaysia, Peninsula Malaysia, Sabah and Sarawak, they have their own policy. Because the forestry actually, because by the British colonial, the management is different. So nowadays, the forestry department or Dinas Kehutanan actually open the big companies to manage the forest. Yeah. So it's like 50 years or 100 years concession. They manage. Yeah. So easy for the department, and they do the harvesting every year, but at the same time, they have to manage the forest. So it depends on them how the annual coup. Yeah. So nowadays, no more deforestation from natural forests. We don't do that. Whatever forest that I don't know here in Indonesia what they call. It's like permanent forest and natural forest. No more deforestation. Now this is related with the UDR. The same like we have the commodity where we have under Ministry of Commodity and Primary Industries, including forestry, timber, and also the commodity like rubber, cocoa, and oil palm. And to comply the EUDR, when they open the area, no more open area, especially for deforestation. Otherwise, they will ban for the product. So this is how they manage, yeah, to comply with the EUDR. So to answer that question, I think I think Indonesia, they have their own policy on the legal deforestation, but in Malaysia case, we have the normal logging in natural forests. Yeah, even we have different class of forest. For example, class number 1, if the forest is class number 1, it's totally protected. There is no deforestation. Yeah, but class number 2 is the productive, means we can log. But before they doing that, they have the inventory if the forest is rich or not, rich in terms of the valuable timber. Yeah. So I think I hope answer your questions. But you have question number 2. What's that?
Did the government should considering some the agroforestry system to do it?
Okay. Yeah, I think in Indonesia they have very good in terms of agroforestry because of the policy I mentioned just now. Same like in Philippines, in Thailand, in other countries, maybe also in India or Pakistan. Because I think here in Indonesia is very good in terms of the community forestry, to get involved the people to manage together with the forest. Yeah. So I think that's a very clear. That's why we can see, especially in Central Java, they have the many agroforestry practices. From that slide that I shared just now, it's many combination, many practices, and also the system. Yeah. So yes, of course, the agroforestry is for the Indonesian context is very important. But in Malaysia, the policy of agroforestry is not really clear, because our more on the the commodity like oil palm, rubber, and so on. But we also encourage the agroforestry, as I mentioned, just for the Saradiri. Yeah, to reduce, stress, food. But we hopefully that the government, because we don't know, because the government always change every 5 years, then they come with different story. They do this and they do this, and yeah, you don't know. So, yeah.
Okay, thank you, Doctor.
Okay, any other question?
Hello, Dr. Effendi. My name is Faisal. I have a background in social anthropology. In my view, urban ecology and agroforestry practice in city will be difficult to implement effectively as long as the structural problems such as inequality between urban and rural areas remain unresolved. Cities depend heavily on rural region as source of food and other resources. For example, Jakarta relies on the West Java for the food supply. Jakarta tanpa Jawa Barat gak bakal bisa hidup mereka. At the same time, many structural issues affecting farmers, such as low incomes, unequal access to resources, and persistent feudal-like relation in land ownership and agricultural productions, have yet to be addressed. As a result, many farmers seek alternative livelihood by migrating to the city. This process ultimately contributes to urban population concentration. As more people compete for limited land and housing, it becomes increasingly difficult to preserve green space or development urban ecological practice. In the case of Jakarta and its surrounding regions, I believe environmental challenge cannot be separated from the structural inequalities between rural and urban area that continue to drive migration and massive development. Given these structural inequalities, how do you see the prospect of urban ecology and agroforestry practices? Are ecological solutions alone sufficient, or do they need be accompanied by more fundamental socioeconomic transformations to reducing this inequality? Thank you.
Thank you for the question. Okay, to answer this question, actually, for the government level, is not standalone. Yeah, because of course the different expertise, they not only on the ministry level. Sometimes the ministry they don't know. They are just appointed by the prime minister or the president. Yeah, and even they have the advisor, ataupun dipanggil apa setiap politik and don't know. And depends to what the advisor they have. Yeah, sometimes they have, if they go to the each ministry to get data, but to realize this, actually they must cooperate, not only one ministry or not only in the single ministry. Yeah, from the forestry expert, NGO expert, yeah, the academic expert, then that can be realized. Yeah, so I think it also happened in other countries. Then when we, because this is about the policy, so that's why in the government, especially in Dewan Rakyat, they appointed the academic person, yeah, or also who are working on that particular, for example, yeah, something people that the working in the environment expert, forestry. Then we need to sit together. Then we can do that. But that's why, as I mentioned, this is easy to talk, but difficult to to translate. Yeah, from the slide, yeah, very easy. We can do this. But who are we talking to the big people like ministry, right? But of course we have the platform to deliver that the idea, yeah, because of course in every country they have yeah, for example in my country, for example, we have the higher education ministry and they come up with the many proposal to study this, yeah. And I think also the same with Indonesia, yeah. So I think that's I mentioned what I mentioned just now. So we need to sit together, then yeah, we can achieve this. Either they accept or not, it's depend to them. The idea, yeah. I hope I answer your question. Yeah.
Okay. There's sorry for there is an intermezzo. Please show the question from the Zoom. There's one online question, Dr. Afendi. This is Joseph from Philippines.
Thank you, Joseph from Philippines. Okay. Yes, this is about the wildlife habitat encroachment while also meeting the livelihood needs of communities living near protected areas. Yeah, I think this is a common issues. Yeah, I remember in Malaysia, we visited many companies plantation that facing with the same issues. Yeah, for example, in oil palm, even a small oil palm, smallholder oil palm, they have the elephant that damage the oil palm, young oil palm that just planting. Yeah, the damage. And other than that, the monkey, long-tailed macaque, yeah, also damage the farm. What else? Babi hutan, yeah, this is common. Yeah, I think maybe the same case also in Indonesia or Philippines. Gajah, yeah, landak, landak. The landak always eat the young shoot of the oil palm. So you imagine how much they lost only for the replacement of the the seedling. But this is only happen just in the border. Yeah. So they do many mitigation, like they put the zinc, but you can imagine how much the cost for each, and then they have to do that for thousands, 10,000 and above the seedlings, right? Right. So yes, as I mentioned, this is wildlife conflict when we open areas. Maybe for for the insect may be easy because, for example, in apiculture we can create more nectars, the horticultures to create honey. They can absorb many plants surrounding the area, but this is difficult for the big animal that they encroach and they damage our plant, our farm. Then yes, I think this is different. It's up to it depends to what the types of animals, the wildlife animals that encroach to the farm. Yeah. Now I share, like, this is common, like happen in our campus, for example. I just a bit away from this question. I give example, long-tailed macaque in campus in my campus. You know, the student always feeding them. Yeah, feeding them with nasi kuning, kui. You know what happened? You change the behavior of the animal. They're supposed to take fruit, the wild fruit in the forest. Somehow you give chicken, KFC, McDonald's. That's this animal. Wow, ini sedap lagi. Ini lagi sedap daripada bau hutan. You see, you change the behavior actually. That's why when they cuti, for example, cuti semester break. Hey, where is the people? Where's the ladies that always feeding me? Yeah, they come to the building. They take the shoes, they take everything, they take the penyapu and so on. You see, I'm not the wildlife expert, but I learned from my friend. Actually, you change the behavior. So it's not because when you go to the zoo or anything, then when the guide say, don't feed them, right? Same case like if you, I don't know, if you go to Sabah, they have the orangutan rehabilitation. You know, the orangutan along the way, they always waiting you. They catch that's why they remind, don't put your handphone like this. Some they jump and put your handphone, then just bye your handphone. Yeah, because the people already changed the behavior. So it's not because what pity with them, why we cannot feeding them. No, because that's, you don't know, because the wildlife access more knows about that. Yeah. So this, I don't know. I don't know why this habitat, but we need to think that why they damage, why they encroach. Yeah. Otherwise, for example, for example, in this case, if let's say the long-tailed macaque, what they need, then you have to plant lah, maybe coconut. Yeah, coconut, just a border planting, so to create food for them as a natural food. Don't feed them with the nasi lemak or nasi kuning, or then that's a big trouble. And the future generation of long-tail macaque, they don't know, yeah, because even the animals, but in psychology, yeah, you change the behavior actually, yeah. So my suggestion is that to this question to Joseph, maybe what we can do is we create the natural fruit for particular wildlife. Yeah, for the elephant, what they need. Yeah, maybe have to plant more bananas, or landak or whatsoever. So because it's not really specific, yeah. So that's my suggestions to avoid this happen in the future. So yeah, thank you, Joseph, for the question. I hope I answer your question. Thank you.
Thank you, Dr. Afendi. Maybe one more question. Okay, so
Okay, sir. Thank you so much. So my name is Mohammad Arif, and I am from Pakistan. So my question is about the deforestation in case of the palm oil. I think that Malaysia is also one of the biggest palm oil exporter, and as compared to Indonesia, Indonesia lost 400,000 hectares in 2025 and 2024 because of the palm oil. So what do you think that in your country, how does the government keeps balance between the palm oil and the forestry? Because you also the one of the greatest exporter of the palm oil. Yeah, thank you so much.
Thank you for the question. Yeah, yes, we do agree that we have oil palm. Yeah, we have oil palm, but at the same time we conserve the forest. So since EUDR introduced no more land expansion for the agriculture, either for oil palm, for the rubber, and cocoa. And for information, the owner of land in Malaysia is different. Yeah, for example, the people might confuse why this forest cut it. Yeah, but for us we know because I'm forester. Or this land belongs to the state government, not belongs to the Dinas Kehutanan. And one more thing, it's owned by the, how to say, pribumi. Pribumi means the local people, by Tanah Adat. Yeah. So, if the land owned by the state government, no more deforestation, no more land expansion for agriculture by the UDR. So now the people from Europe, FSC, and so on, they come to Sabah to check the land. Yeah, they can replant the land from the previous land, but not for opening new land. So this is the balance. Yeah. Even just now I mentioned that the concession company, they have to manage for within some company they have the 50 years. Some of them, maybe the big company, they have the 100 years concession. The Dinas Kehutanan or Forestry Department say, I don't know, I just take royalty from you, but you have to comply. But we just come to check your forest, you know, to meet all the, you know, just sustainable environmental aspect and so on. Yeah. So in Malaysia, no more deforestation. If there deforestation, that's illegal. Yeah. So this is how we balance the forestry and also the agriculture. Yeah. Clear?
Okay.
Yeah.
Thank you, Dr. Afendi. Maybe one more question. Okay.
Okay, thank you, sir, for for the time. My name is Juanisa. So I did a lot of research on human and wildlife conflict, actually, sir. And one of the very common questions here between wildlife conflict and One Health is what if in the future we succeeded to create this urban ecology. So a lot of cities turn to greens and lots of nature around the city area, but the wildlife are coming into the cities. And like One Health, one big factor of One Health is interaction between wildlife and humans. And we just want to know what's your perspective on that. Thank you.
Thank you for that question. So whatever we do, actually, they create more opportunities or potential. Yeah, so same like other cases. Yeah, what is not, this maybe this is solution only applicable only a few years. Then they will create more opportunity or potential to us to study more. Yeah, I give example. Acacia, it's originally from Australia. Yeah, same also eucalyptus. Yeah, I just give the analogy like this. Yeah. Yeah, in Sabah we plant acacia, pelita, eucalyptus pelita, because that is a fast-growing species. Even they are exotic species. Why? Because if we waiting from the native species, especially Meranti and so on, then how we sustain the production, especially for the mill, for the timber production, because this is contribute to our GDP for the country. So what the solution? We use the exotic species, right? Okay, and then we believe that they are far away from their pest and disease because they're from the subtropic to the tropics. All right. But then, after a few years, they create more pest and disease. That's why no more. Now we don't plant anymore acacia because of the ceratostaisis. They create problem. You see, same like the question. We apply the urban in the cities and they create the more this. So, in general, I can say that this is more future. We have to study how to control that. Otherwise, the people cannot do S2 and S3. Yeah. So I hope I answer your question. Yeah. So that's it. Yeah. Yeah. We can see the occurrence, the incident. It's if implantation, if that's create more than 50% economical damage, then that's a serious. Then we need to study more intensive.
I know it's already
Yeah. 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 Yeah.
And I think it could possibly.
Yes. Yeah. Correct. Yeah. Yeah. Thank you for that question. Very, very good point. Yeah. Yeah.
Okay. Thank you guys for all your questions, and thank you, Dr. Afendi, for the lecture. And please give our biggest applause to Dr. Afendi.
Thank you very much. So I'm happy that so many questions. I think that there's still more questions. So I'm happy that I'm not talking alone. Yeah. If no more question, I mean I lost. Maybe the lost they don't know. So I'm happy. If you ask me, that meaning that you understand what I'm delivered. So thank you, but thank you very much again.
So that's from Dr. Afendi, and he mentioned macaque, the long-tail macaque. So we have our next speaker here, Dr. Mila Power, who will talk about our closest living relative that are the primates. So this is the resume for Mila Margaret Rosemary Power. She is a biologist and researcher based in Auckland, New Zealand. She's now conducted research on behavioral and social dynamics of captive Bornean orangutans or Pongo pygmaeus at Auckland Zoo, focusing on group integration following the introduction of a new individual. And she also do research, contributes to improving captive animal management and supports orangutan conservation programs in managed setting worldwide. So give your applause to Dr. Mila.
Oh, ya. Oh, maaf. Oke. Terima kasih semua orang. Saya Mila. Saya dari Selandia Baru. Oh, maaf. A little bit nervous. Today I'm going to be speaking about the work that I am doing at Sabangau National Park. Okay, who am I? My name is Mila. I'm from New Zealand and I am here for 1 year working with the Bornean Nature Foundation. I am here to work on the Orangutan Health Project, and I have a background in biology and anthropology. These combined together have helped give me a perspective of how important a multifaceted approach is to complex health issues. My current work with the Bornean Nature Foundation contributes to a long-term project investigating the abundance and diversity of gastrointestinal parasites of wild orangutans at Sabangau National Park. To carry out this work, I am based out of Camp Lahag in Sabangau, where I collect and analyze samples to better understand orangutan health. Sorry. Sorry, still talking. And I just want to say to the students, as helpful as my university education was, I found emailing lecturers, emailing postgraduate students and volunteering with them has given me so much invaluable experience. I've had the opportunity to work with so many different taxa, invertebrates, birds, primates, and I think this is what helped contribute to me getting this position. I'm not classically trained in parasitology, but it's been a really great learning curve, and I've had many people helping me along the way. Okay, Sabangau. Camp Lahag, Laparan Alam Hutan Gambut. It is a former logging camp that has been transformed into a research centre. It's located within Sabangau National Park. Sabangau National Park is one of the largest peat swamp conservation areas in Indonesia, and it is a site of significant ecological importance. The area has been protected as a national park since 2004. The research area that I work at was selectively logged over a period of approximately 40 years. Legal logging continued from the 1970s until the mid-90s, after which it was made illegal, but did continue in the area. However, through recent efforts of locally led community patrol teams, illegal logging is believed to have stopped since 2004. Despite the illegal logging stopping, its impacts are still visible today. Timber extraction canals dug by the loggers combined with forest loss have disrupted the peatland's natural hydrology. These canals continue to drain water from the peat, reducing its ability to function like a natural sponge. So it's not able to retain water. So during the wet seasons, it's much more prone to flooding. And during the dry seasons, it is much more prone to wildfires, with some particularly devastating ones in 2015, 2019, and 2023. This is highlighting the long-term consequences of peatland degradation. Sabangau as a site provides an excellent example of why a One Health approach is necessary. It exemplifies the intersection of human health, wildlife health, and ecosystem health. The peatland swamp provides numerous ecosystem services, including carbon storage, biodiversity conservation, and resources that support local communities. Changes to the health of this ecosystem, therefore, not only have consequences for wildlife, but for local communities and the environmental stability. Threats to Sabangau include peatland drainage, fires, conversion for agriculture, timber logging, wildlife hunting, and climate change. These threats will eventually lead to reductions in both the abundance of individual species and species richness, resulting in reduced biodiversity. The number of services provided by the site highlight the importance of conservation at Sabangau. Conservation efforts include replanting areas, continual research and monitoring of the flora and fauna, educating local communities, and continual damming in the area to assist with water retention to help with those wildfires and flooding. The researchers cite proximity to the forest edge and greater accessibility leads to relatively high encroachment and hunting presence. Exploitation of wildlife in the area still occurs, including fishing and the hunting and trapping of soft-shell turtles, bearded pigs, sambar deer, and flying foxes as a food resource, as well as the capture of greenleaf birds, box turtles, and blue-crowned hanging parrots for sale in local markets as a part of the pet trade. However, in recent years, this activity has largely ceased and decreased owing to increased protection and possibly reduced populations of these species. In addition to animal resources, plant resources are used by local communities and are harvested for their medicinal properties. This resource acquisition from the forest highlights the cultural and economic importance of Sabangau for local communities. Sabangau is a biodiversity hotspot and supports many species of ecological, cultural, and economic importance. I've included a table here on the slides based off of 2018 surveying, just showing brief number of species found in the area. I'm sure there have been many more since then. This is since 2018. Surveys conducted in 2018 also confirmed the presence of 46 species currently listed as threatened by the IUCN. In addition, 59 species that are legally protected in Indonesia and 22 vertebrate species found within the ecosystem are endemic to Borneo. Most notably, Sabangau is believed to contain the largest contiguous protected population of the Bornean orangutan. And all the photos included here are ones I've just taken walking around the forest. So it's an incredible spot. I very much recommend visiting it if you are able. Okay. The One Health model employs a multifaceted approach to complex health issues. It recognizes the interdependence of human health, animal health, and wildlife health. The goal is to address and resolve complex health issues through collaboration across disciplines, acknowledging the interconnected roots and consequences of such issues. A One Health approach to complex health issues challenge is especially appropriate in Indonesia due to the high level of biodiversity, endemism, and the rapid land use changes, as well as the high rate of human and wildlife contact. Sabangau is an ideal site to explore principles of One Health in action, as it is not an ecosystem that exists in isolation from people. As you've seen, we've got hunting and plant exploitation. We've also got ongoing research, resource acquisition, and changes to one component of this ecosystem can have knock-on negative consequences for other areas of the ecosystem. The interconnectedness of Sabangau makes it an excellent natural laboratory for understanding the principles of One Health in action. Right. Sabangau is believed to contain the largest contiguous population of Bornean orangutans. It is a site of significant importance in orangutan conservation. Orangutans play a vital role in the maintenance of ecosystem health. They provide many ecosystem services such as seed dispersal. As highly mobile frugivores, they're able to disperse seeds much larger and much further than other vertebrates in the area. This supports the forest health by maintaining a high level of biodiversity and supports the long-term stability of the ecosystem. The importance of orangutans extends beyond their ecological roles. They also provide economic benefits through ecotourism and support scientific research, education, and public engagement with conservation. As one of our closest living relatives, orangutans offer valuable insights into human and non-human primate behavior, cognition, and behavior. Conserving orangutans therefore requires a multifaceted approach: habitat protection, restoration of degraded and fragmented forests, rehabilitation of displaced individuals, scientific research, law enforcement, and community engagement all play important roles in ensuring the long-term survival of orangutan populations. An important component of these conservation efforts is health surveillance. Monitoring the health of orangutans allows researchers to identify potential threats and to individuals and populations before they become severe. At the same time, because orangutans are closely connected to the ecosystem they inhabit, changes in orangutan health can provide valuable information about the broader environmental changes occurring within the environment. Factors that influence orangutan health include habitat degradation, fragmentation, and loss of insufficient nutrients, insufficient water, heat stress, increased contact with humans, increased contact with domestic animals, and introduced pathogens and diseases to the area. By monitoring the health of orangutans at Sabangau, the research I'm doing with BNF contributes towards orangutan conservation. By monitoring the gastrointestinal parasites in orangutans, we're not only learning about the health of individual animals, but also gathering information that may help us understand the health of the wider ecosystem and environment. This also allows us to monitor for potential new parasites to the area and respond accordingly. Parasites are an important part of any ecosystem. However, they become a problem when the ecological balance changes. This can be as a result of changes in the environment, animal, or human health. A healthy host is able to maintain a balance of microorganism communities of bacterial, helminthic, and protozoan species. However, various external factors can impact this balance and result in adverse health outcomes for the health of individuals. A decline in ecosystem health can have knock-on effects to orangutans, reducing their overall health and negatively impacting their immune system. This can result in an increased risk of parasitic infection. This can lead to disease outbreaks and epidemics, which have the potential for interspecific species transmission. Gastrointestinal parasites of orangutans offer an effective way to model how a One Health approach can contribute to orangutan conservation. Parasites as tools for indicators of ecosystem health will simplify data for decision makers and provide focal points for strategic planning, policy changes, specific management actions, and resource allocation. Why should we care about parasites? Firstly, we should address what a parasite is. They're organisms that live in or on a host organism, getting its nutrients at the expense of the host. The parasite-host relationship functions by appropriating resources, reducing the host's fitness to varying degrees depending on a variety of factors. As a consequence, the presence of parasites has the potential to negatively impact human health, animal health, food production, economic trade, and biodiversity conservation. In a healthy and balanced ecosystem, a parasitic infection should not impact host health to a significant degree. The host should have the resources and immune ability to fight off a parasitic infection and maintain a high degree of health. It is when the system becomes unbalanced that the host is unable to fight off these infections and can be overwhelmed by the parasitic infection. Because of this, parasitic infections operate as useful indicators of health. In a healthy environment, we would expect to see a diverse and often stable array of parasites. However, a high number of parasites or dramatic changes in population sizes can be a warning sign of an ecologically stressed system. Parasites can be used as indicators of environmental change. For example, helminths often rely on complex life cycle interactions to ensure their transmission, relying on a variety of hosts at different life stages. A host parasitic assemblage could potentially reflect the host position within the food web, as well as the presence in the ecosystem of any other organisms that participate in the various parts of the parasite's life cycle. Changes to host parasite diversity may be reflective of changes in the ecosystem, disturbing or altering transmission patterns, reflecting changes in the overall ecosystem biodiversity. Parasite compositions of wild, semi-wild, and captive orangutans have been well studied, so we do know the general range of parasites that are able to infect orangutans. This includes both protozoan and helminthic gastrointestinal parasites. How do orangutans acquire these parasites? The white dots in these images are there to represent parasite eggs, oocytes, and cysts. Both biotic and abiotic factors play a role in the susceptibility and transmission of parasites to and from other orangutans. Soil acts as a vector of parasites. Contaminated soil fruit and leaves can transmit viable parasites, eggs, oocysts, and cysts to host orangutans. Eating or interacting with these contaminated soil, plants, or fruit materials puts individuals at high risk of infection. Fecal oral transmission is another route of parasite transmission. Direct or indirect contact with contaminated feces containing parasite eggs can lead to infection. Interactions with infected conspecifics can result in infection, as well as interactions with different species. Orangutans are able to catch parasites from other wildlife species that come into contact with or frequent the same areas as them. Under this umbrella of interspecific transmission, species can be transmitted to and from humans. There is a higher risk of this in captive settings, rehabilitation centres, or areas with high ecotourism where researchers, guides, and visitors may inadvertently transmit the parasites to or from the orangutans. Environmental stresses also make orangutans more vulnerable to parasitic infections. Stress, malnutrition, environmental challenges such as wildfire smoke can weaken an individual's immune system, making them much more vulnerable. All right. I'm now going to briefly cover the work that I have been doing with BNF. My work involves the analysis of fecal samples collected from the Sabangau National Park. That I use the analysis techniques of sedimentation and flotation to detect parasites, species, abundance, and distribution. Fecal samples are a great tool for analyses. They're non-invasive, relatively easy to collect, and can tell us a lot about the health of individual orangutans. In addition to the fecal samples, we have other methods of monitoring orangutan health. We perform visual assessments of the quality of health of orangutans, noting features such as weight and injuries. Additionally, we collect and analyze urine samples, which can also tell us a lot about the health of an individual. It is important to assess orangutan health with many methods. The presence of parasites does not immediately mean an orangutan is unhealthy, as they are a natural part of all ecosystems. However, they can cross a tipping point when they have significant negative impacts on the health of orangutans. By monitoring all these different avenues of health, we can better understand exactly where that boundary and tipping point lies. The motivation behind analysing orangutan parasite composition is to analyse the health of orangutans at Sabangau, to track changes in the environment and its impact on parasite composition of the local orangutans, to track if factors such as age and sex impact orangutan abundance, and to build up a database of known parasites in the area, to build a long-term data set of orangutan health at Sabangau. Right, sample collection, the very glamorous part of my job where I get to go out at 4 a.m. to collect poo from orangutans. Specific protocols are followed to ensure that fecal samples are collected from orangutans in a standardized manner. Samples are collected non-invasively from this wild population. The primate team at Sabangau will go out and locate an orangutan. They will then follow that orangutan until they build a nest, where it will be marked with a GPS point. We will return the next morning at around 4 a.m. to then collect fecal samples from the orangutans, as generally the first thing they do when they wake up is go to the bathroom. Ideally, we would be collecting these samples for 10 days in a row and then analysing the samples from days 1, 5, and 10, just to give us a better picture of the long-term parasite compositions of an individual. Once we collect the samples, ideally around 5 to 10 grams, we will store that in SAF, sodium acetate acetic acid formalin, not the Society of Agroforestry, thank you. And storing the samples in the solution allows for the long-term preservation of them, and it also maintains the parasite morphology within the samples. As I said, currently in the laboratory, we're using the sedimentation method. We've been using this method since 2024 of May, so we've got 2 years of data using this one, and we're currently trialing a new method, the flotation one. Using these in conjunction will just help give us a better, more accurate picture of the local parasite populations. So we start off with weighing out a sample of the fecal sample, grinding it up with SAF to ensure that everything is nicely evenly coated, and then strain that out so that And then we will add ethyl acetate to the sample. This helps to remove debris and fat. We'll then centrifuge that. Then as you can see, these lovely layers form in that third picture. What we want is at the very bottom of that tube, that's where all the parasites are. So we will dispose of what is at the top. We'll repeat that again with SAF to further clean the sample, discard the superannuant again, and then dilute that with water to better allow for more clearer visibility. And then we will analyze that. For each sample, we analyze 3 slides, and we go up and down to ensure that we cover the entire slide. We're currently trialing the flotation methodology. This operates on a slightly different principle, where rather than the parasites sinking to the bottom of the tube, we're hoping that they will be floating to the very top. This is a much better method for detecting protozoans, which the sedimentation method isn't particularly effective. We mix these samples with a sugar water solution called the Sheathers solution, and it should ideally have a specific gravity heavier than that of the parasites. And then we fill it up until there's a positive meniscus, as you can see in the second photo. Put a cover slide on top of that, wait for about 60 minutes, and then put that onto a slip for analyses. Because this is still being trialed, it has not yet been included in the statistical analyses. I've got some preliminary results for you guys. So in the samples, we are finding Balantidium coli. This is the most common, and we find these in 2 forms, trophozoites and cysts. We're also finding Strongyloides at a very high rate, Strongyloides species, as well as Strongylids. And then at much lower rates, we are finding, also hookworms, and then at much lower rates, we are finding Enterobius, trematodes, Ostophagosum, and Trichoris. And so I've broken those down by sex there. So as you can see, the females have an overwhelming bias towards the Balantidium cysts, where the males have a much more distributed parasite species abundance. And this is based off of the results of 135 individual samples across 2 years from 17 different individuals. We've got 5 females and 12 males represented in this. Okay, and several of these parasites detected do have zoonotic potential, including the Balantidium, Strongyloides, and certain hookworm species. This again highlights the importance of continued monitoring of parasite communities, not only for orangutan conservation, but to also monitor potential risks to human health and the potential of disease transmission from orangutans, from humans to orangutans, or the other way. And then I've just further broken this down into individuals. So here we have all the female individuals. And as you can see, Georgia is really throwing off the curve. She unfortunately has quite a few of those Balantidium cysts. This is just built up as an average across all the samples to give a big picture. We have more samples from fewer females, you may note. This is because at Spango we have females tend to have a much smaller home range. So we have a smaller group of resident females, which we're able to continuously collect data from, where with the males, they have much larger home ranges. So we'll see more frequent, we'll see males coming in more frequently, but then they'll leave more frequently as well. So more males with fewer samples, and then fewer females with more samples. And you can see that here again. And this is with the males. So again, you can see that we've got many more individuals. They also have a lower parasite load overall compared to the females. Then again, we've got a couple individuals just throwing off the curve a bit. Poor Caesar and Eros unfortunately had a bad case of Balantidiums the few times they were sampled. Right, and then I've broken the distribution over time down by helminth parasites and protozoan parasites. Done this due to the significant differences in lifestyles. So as you can see with the helminths, I've plotted those across the dry and the wet seasons. We have very clear peaks in the dry seasons, in the dry season of 2025. Unfortunately, we haven't yet been able to fully capture another dry season. As you can see, we started and have caught up with being midway between dry seasons. So just reflecting again the importance of continual monitoring. We believe that there may be a higher parasite prevalence during the dry season because of reduced immunity. The orangutans may be dehydrated during this period, there may be reduced food ability, there may be more heat stress. And you again see that reflected in the protozoan distribution across time. The protozoans are the Ballantinium cysts, which is why Ballantinium cysts and trophozoites. This is why you're seeing a much higher presence in the females, again, because they have across the board many more Ballantiniums than the males. And again, much higher peaks during the dry season. Okay, the results of that analysis just reflect again why the continual damming is so important. This is important to retain the water in the peatland swamp, to make sure that orangutans and other species are able to stay hydrated, keep their immune systems up, ensure that plants are able to grow adequate food supply. This will also, so the results of this analysis will also better inform relocations in the future. A big risk with any animal relocation is introducing new parasites and pathogens to an area. If we have a baseline understanding of local parasites to the area, we can make better informed relocations, ensuring that orangutans who are being introduced to the area either have the same parasites or fewer than from the area to ensure that nothing new is being introduced. Another conservation application is continued research in the area. Sorry. If clearer links can be drawn between animal, human, and environmental health, then efforts can be better directed, resources better distributed. Okay, future directions. Ideally, I would love to see a standardization of methodologies across various sites of orangutan conservation, different national parks, rehabilitation centres. The benefits of standardizing this will allow us to have better analyses across sites. And this will allow for better, more widespread monitoring. And one of the best things we can do with this research is the continual collection and analysis in the area to build up a comprehensive long-term database spanning multiple years with representation from multiple cycles of wet and dry seasons. In addition to the implementation of Sorry, getting tired now, I've gone right to the end. I would also like to better link environmental factors with parasite distributions across time, a better understanding of rainfall, temperature, humidity. Those factors will again better inform us as to the exact factors influencing orangutan health. Okay, conclusions. Okay, I hope that from this talk we've all gathered that conservation is a multifaceted issue involving many different disciplines. It's not a single one issue, human health, animal health, or ecosystem health. They all interact and they all impact one another. And because of this, primate health doesn't only have positive consequences for the primates themselves. Orangutans are considered umbrella species, meaning that conservation for orangutans has positive effects for other species in the ecosystem. And this will also have knock-on effects to human health and then broader environmental health. And then just on a personal note, say yes to as many opportunities as you can. I wasn't trained as a parasitologist, but I've had so many incredible opportunities that have gotten me to this place. I've had great training from many different people, and the volunteering I've done in New Zealand had so much overlap with the skills that I've used here, even if they weren't necessarily specific to a parasite laboratory. And then I've got my references, and then a big thank you, terima kasih banyak, to the university for having me. Dr. Helen, she is the head researcher at BNF. She is also my boss and has facilitated this research. Thank you to Egan. She trained me in the laboratory and she has done a lot of the research that I was building the analysis off of, as well as Amber. She was the previous researcher in my position. And thank you to the Borneo Nature Foundation and to the primate team at BNF for assisting with the collection of samples. Thank you.
Okay, thank you, Mila, for delivering your lecture. So when I said our closest living relative, the orangutan, I don't know that they also wake up and go into to bathroom. But yeah, basically what Mila do with her team is also sometimes we also do to human to collect fecal sample, but fortunately we don't have to wake up at 4 a.m. and go to the forest, just hand out how to collect sample and give the patient the blood. So from research that has been done by Mila and her colleagues, the parasites like Plantidium coli and helminth like Trichuris, hookworm, Strongyloides could also be found in human patients. So this is very related to One Health approach. So any of you have question for Mila? Okay, from the eastern part.
Hi Mila, hi everyone. I'm Duala from Jogja. So my first question would be, in my very shallow understanding about orangutan, so orangutan has important roles to uncover the leaves density, allowing the sunlight to enter the forest, right? To enter and to sign the soil. I wonder if the number of orangutan decrease or being sick. I assume it will affect not only the ecosystem and the biodiversity, but in the future also the climate change and also the human, of course. So I wonder if you could tell us more, shed some light about that thing to us here. And my second question would be, correct me if I'm wrong, if I'm not mistaken, you mentioned your background is biological anthropology. Anthropology. Okay, so maybe that's interesting. So maybe during your work in Sigbangao, maybe you could tell a story about the relationship between the orangutan and the indigenous people there, and also the transmigrant. You know, the transmigrant, the the people who came from another area, so non-indigenous people, to work and to open the land there for the plantation or whatever. That's the government program, Indonesian government program. So I wonder how the relationship between the orangutan and the forest and the indigenous people, and also with the transmigrant, and how they affect each other.
Great questions, thank you. I believe the first part was asking more about ecosystem services provided by orangutans, and you're completely right about reducing the density of overall coverage. They naturally prune the forest, so by eating the leaves and building nests, they open up the canopy for much more light to get through, and also the ecosystem roles of spreading seeds around. So was your question, with reduced orangutans, what are we expecting to see like consequences?
Yes.
Yeah, so again, overall reduction in ecosystem health, we won't be having that seed dispersal, and this will have many negative knock-on effects to other species. So yeah, we're going to see a reduction in species diversity in the forests, and this may negatively impact other species which rely on those as food sources, because we'll see fewer plants growing, less dispersal. And then in terms of the orangutan and human interactions, in Sabangau, the local Dayak population, Dayak Naju, there is a very long and interpersonal history there. The Borneo Nature Foundation and Simtrop, I do believe, strive to incorporate ideologies, and they do highlight the importance of acknowledging the Indigenous presence in the area. I believe this is carried out as well by not exploiting the national park to a significant degree. It has been open to ecotourism, and that is for the purpose of public education, sharing an appreciation for the forest, and further supporting conservation in that regard. I can't speak too deeply to the actual philosophies behind it. I am trying to learn more about the Dayak Ngaji presence in BNF, and many of the workers at BNF themselves are Dayak, and they've been really great teachers in that. But yeah, I hope to continue to learn more about it in the future. And sorry, and translocations of orangutan.
Transmigrant. I mean, like.
Open the area around the forest, but native from other region.
Non-indigenous people.
Yeah. And sorry, what was the question about them? Sorry.
No, the relationship between you already explained
Yes.
about the relationship with the indigenous people, but what with the non-indigenous people who open the land? They moved to Borneo.
Yeah.
They moved to nearby of the forest area to
Yeah.
open the land.
Okay. Oh yeah. So the nearest city to Sabangau, the national park, is Kering, and from my understanding, it is a largely indigenous population. There are more recently people that have moved from other cities for job opportunities, but again, from my understanding, it's been a very positive, holistic incorporation of sharing of knowledge and resources. I hope that answered. So I'm still quite new to the area, so I'm still learning.
No worries. Thank you so much.
Thank you.
Any other question?
Thank you, Dr. Mila, for the amazing presentation. And my name is Yuna, and from Jakarta. And I would like to ask one question. Like what I saw before, that there is one health triangle of Sabangau, and there is risk of zoonosis between orangutan and also human. What I want to ask is, have you ever found the spillover, the zoonosis case that comes from orangutan and it affected human in Sabangau area, or any conservation that you found that we can see the parasites that you found in orangutan, that does it cause illness in the human in the area too? Yeah, that's my question.
Thank you for your question. And that's definitely an area I'd love to look at in the future. Currently, there haven't been any studies on parasite compositions of people in the area, or there haven't been any links drawn yet. There have been previous studies on parasite transmission from primates in high areas of tourism. I believe there have been quite a few between macaques, but none yet that directly draw lines between orangutans and humans. But it is something I would love to do. There's just a lot more ethics involved with human health than there is with animal health. Thank you.
Thank you.
Okay, one more question.
Okay, thank you, Mila, for your amazing presentation and your research for us to better understanding about the orangutan and also the parasite inside the orangutan. So my question, so you did your research on parasitology and parasite, and I want to know your recommendation for the community who work or to who live around the Sabangau National Park, who act as the forest as their source of their food. So what would be your recommendation for them to reduce their interaction to the source of the pathogen, which is it's orangutan? So that's my question for you. Thank you.
Thank you. That's a great question. I definitely wouldn't recommend that they need to stop. It's an important practice, resource acquisition from the forest, and especially at the low level it's being done, it's not harmful to the ecosystem. So I wouldn't want to stop a cultural practice. I would just say, just to ensure that produce is just washed effectively, just ensuring that if they're securing food, that it's cooked to a high temperature, and medicinal properties are just washed well with soap and water. It's luckily they are quite easy to sort of get rid of. So it would just ensure that everything's washed well, hands are washed.
Okay, so is there any medicine for them to take before they go to the field, to the forest, or maybe something more strategically, so they can reduce to go to the forest?
Yeah, to reduce the risk. I don't, as far as I'm aware, there's no preventative medicine for parasites, but there's many over-the-counter treatments, medicinally, and also many plant resources. I know papaya seeds have really great anti-parasitic properties. So there's many resources people can take. Luckily, they're quite easy to treat, all the zoonotic ones at least. It's just a matter of not letting them get the infection too bad. So if you are sick, go to the doctor or take some medicine. Thank you.
Maybe one more question. Okay.
Thank you so much. I guess like I hope you have a good time here in Indonesia, especially in Jogja, because I'm new here too. My question is pretty simple. It's like you have done a lot of your work on animal, and then you have the research on animal and trees as well as birds, which I saw in the slides. And you mentioned the human health, and we saw a triangle, and it's like integrated system. So the question is simple, like how do your research supports the integrated system, like you call One Health system, though you have done some sort of awareness sessions, I guess, with locals, and then how you can explain to a student from like technologies and the idea about your research, how does it integrate it, because most of your work done by animals, I guess, the research and trees and different things I didn't like catch during, but what I assume, like in pretty simple way, I can say, how does a human is integrated with your research, though most of your work is done on animals?
I think the previous talk highlights that really well, the importance of green spaces for human health. So while it may not be directly obvious how researching orangutan parasites will affect humans, is actually lots of different pathways. So again, as I stated, the reductions in ecosystem health, if we lose orangutans, that's going to negatively impact humans. We're going to have less green space. There's going to be less opportunities for ecotourism, for education, which will have economic consequences. There's also the increased risk of zoonoses. So it's assumed that we would be able to get those parasites from orangutans, so there'll be a direct cause there. Yes, there'll be, and then also affecting cultural practices. So if there is a reduction in the ecosystem health, if we're seeing fewer trees, maybe fewer medicinal trees, then local people will find those much trickier to acquire, as well as hunting. Be much harder to find animals there as a food resource. Does that answer that?
Yeah, I guess like I mean, like you have done some sort of sampling, collecting samplings,
Yes.
and you had some sort of symptoms that affect you, like human life. Let's suppose for you mentioned that you went earlier to collect samples. So did you take any kind of, the girl mentioned about the medicines, though you are not doctor, but have you done any research that like the symptoms that had some problems with your health during the sampling?
Yeah.
Did you had?
Oh, sorry. Oh yeah, so we wear lots of PPE. So whenever we're collecting samples, whenever I'm in the laboratory, I'm wearing gloves, a mask, a lab coat, and then I'm washing my hands constantly and using hand sanitizer. And I'm self-monitoring. If I feel unwell, I'll go to the doctor, and I can probably pretty clearly point towards what it might be. But for now, I and the team I work with, we're wearing our gloves and staying healthy.
Yeah, helps.
Thank you.
Okay, we have one question from the online participant. So this is from Wiwara from Yogyakarta.
Okay, thank you, Iwara. That's a good question. For the first part, why is it not more widely known? One part of my research, I'm really lucky in to be working with charismatic megafauna. I hope everyone loves orangutans. You know, they're cute. Kids like toys of orangutans. Who doesn't love orangutans? However, on the other side, who likes parasites? They don't make a very cute toy. People aren't all that interested generally in reading about them, hearing about them. You don't get cute videos of parasites like you do with orangutans swinging through the trees. So I think that's one of the main reasons why they're not more widely known. There's just not as much public interest. Why do many indigenous living near conservation? I think that's a tricky one, the lack of access to conservation areas from Indigenous people. In the small amount of research I have done, there's a growing issue globally of dissonance with Indigenous communities and local ecosystems. There's many factors contributing to this, one of them being the need for work. So leaving those spots. There can also be, I suppose, conflicts between conservation goals and Indigenous land use. What may seem like a very clear positive cultural practice, such as harvesting from a specific area, may not be seen the same by potentially a government body that doesn't share those same knowledge systems or beliefs. And so there can be a disconnect there. More broadly, why has this knowledge not been effectively communicated? And in terms of why it hasn't been effectively communicated, it's still very much in its early days, this research. I believe the first sort of more comprehensive study on orangutan parasitology wasn't published until 2012. And since then, there is definitely a growing body of research, but not massive. Again, just the continual research in this area will assist in that. And hopefully with growing knowledge and research that it will be made a bit clearer how we can change principles to better reflect this and assist. I hope that answered everything. Thank you.
Okay, thank you, Mila, for your lecture and Q&A session. So from this last two lecture, I think we have take-home message that just leave the wildlife alone, don't touch them, don't keep them as a pet, because you know, they're full of parasites, and use maybe your boot or your slipper when you go outside, because most of the parasites are the soil transmitted helminth group. And don't forget to wash your hand, because most of the parasites are fecal oral transmitted, right?
Yeah.
Okay, I think that's all. Please give your applause to Dr. Mila. So I think it's all from the morning session. Thank you for your enthusiasm for the session. Now it's time for lunch, and when will we go back here again? Yeah, please come here again at 1 p.m. Thank you.
burning PowerPoint slides from yesterday session. So I hope you can check your Alloc platform. And if you are having any trouble with that, you can ask the committee to help you with the issue. Thank you. Welcome back, everyone. I hope you had a enjoyable lunch break, and maybe some of you already have a prayer break too. And maybe we can wait some our friends who maybe have a prayer break right now. So before we start, we forgot to give a token of appreciation to our moderator before. So right now, before we start, I would like to invite Dr. Alvin to the stage and Dr. Edwin to, as a representative of our organizing committee, to give our token of appreciation to Dr. Alvin as a moderator for this morning session. Thank you, Dr. Alvin and Dr. Edwin. And now I would like to greet our friends who joining us online. I hope you already take your lunch break and ready to learning this afternoon. And in this afternoon session, we will be taught directly by researchers from France. I'm looking forward to your active engagement, everyone, energized by our delicious lunch that we had before. And please note that in this session, there will be a 20-minute Q&A session. For participants who joining us online, please submit your question in the Q&A section provided in the Zoom. And now, let me introduce our fourth moderator that will lead this session, Dr. Farida Nur Oktaviani, Master of Biotech. So, Dr. Farida is a physician and lecturer at the Department of Microbiology, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. She is also a member of the Mycology Division, specializing in fungal infection. She also active researcher in infectious disease and molecular diagnostic, including studies on COVID-19 and SARS-CoV-2. She is also an expertise and research interest in microbiology, medical mycology, biotechnology, molecular diagnostic, and medical education. So everyone, please joining me in welcoming Dr. Farida to the front, and time and stage is yours.
Okay, good afternoon, everyone. Today we will have an afternoon session. So we will have another one last session for today. So we are gonna have Prof. Roger Frutos. So Roger Frutos will be joining us by Zoom. So maybe I will greet him. Hello, Prof. Frutos. Are you already on the Zoom? Okay, maybe before we are waiting for his response, I will resume him. So Prof. Frutos is a research director of CIRAD. So CIRAD is like a French agricultural research center, and he is a specialist in infectious disease, dynamics, and infectiology. And he is also a former professor and deputy vice president for international affairs with Asia at the University of Montpellier. He also the adjunct professor at Mahidol University, Ramat Tibadi Hospital, and invited professor of Universitas Gadjah Mada. He is also a director of projects and partnership of the Association of Southeast Asian Institution of Higher Learning, and he also a director of Dynamate, an international distance learning master's program dedicated to emerging infectious disease dynamics. So please, Prof. Frutos, are you there? Hello, Prof. Frutos. Maybe you are unmute.
It should work now.
Yeah,
Sorry,
hello, Prof. Frutos.
microphone was off. Thank you. Thank you very much for your introduction, and thank you very much for this invitation.
Okay. So today Prof. Frutos will be giving us the material about the dynamic surveillance about the One Health. So maybe it's about 50 minutes to explain your slides. And we will continue it with the questions. So maybe this is the times for yours. Thank you, Prof.
Thank you very much. Let me share first of all my PowerPoint. Okay. Please just let me know if you see it.
Yeah, we already see it, but it's not on slideshow. Yeah, okay.
Not yet?
Yeah, it's already fine.
Okay, good. Just one more test. Do you see the slide moving?
Yeah, okay.
Okay, perfect. Everything works then. Okay, thank you very much. So, thank you again. First of all, I want to thank Professor Tree and all the organizers, Prof. Mustafa, all the organizers at UGM for inviting me to give this presentation. I'm very happy to do it. To speak the truth, at the beginning, I was a bit surprised by the topic Prof. Tree wanted me to address. So the cultural dimension in surveillance, outbreak response, etc., with respect to One Health and emerging diseases. And first of all, it was a bit surprising. Then I said, wow, that's a very good idea, actually. He asked me to cover any kind of specific aspect in the French approach. And my answer was that there is no specific aspect in the French approach. There is nothing specific in France. There is, however, something quite specific in the Western culture. And to me, was a good starting point to consider. Maybe we could try to see different kind of philosophy in the medical approach in the world, and compare and see which one may fit, and if they don't fit, why, etc. You will see that basically nothing can fit, and all I distorted, and that's finally what I'm going to do. And I finally found the topic very, very, very interesting. And because addressing the cultural dimension is addressing the way we think, the way we behave, the way we are biased in our approach, and the way we can influence each other, and not necessarily in the good way. So finally, it turned out to be a very interesting topic to cover. So I'm going to try to do that, if you agree. So first, we will start from today, but we need to do a journey back in time, because today we are thinking of modern medicine, but modern medicine is technology, basically. Okay, and technology is a tool. Technology is not philosophy. Technology is not what makes us react, think, and understand things. It is philosophy who does that. Philosophy is what shapes our perception and decisions, and the way we are going to apply the technology. So let's go back in time and see what we are dealing with, basically. Of course, it will be a bit more complicated than that, but I would say we can see three different main philosophies. Of course, there are other parts, but the three main that shape a large part of the world basically are what? On one hand, you have what we call the Western medicine. Okay, it's originating in ancient Greece with one physician called Hippocrates, of course, from the island of Kos in Greece, or short Hippocrates. That's it. And so you see, it's from the 5th to the 4th century BC. And he was associated also to the worship of the Greek god Asclepius, known as Aesculap in Latin. And Hippocrates was very important because he's the one who said that diseases has nothing to do with gods, have nothing to do with divine punishment or whatever. It's a physical matter. Okay, they didn't know physiology at that time, but for him it was a physical matter. It was not a spiritual matter. He's the first one who brought that issue. So, and he is the founder of the what we call the Western medicine and the philosophy. Then we can consider another one, the Indian medicine or Ayurveda. Ayurveda also goes back to basically the same time, 4th century BC. And we have a third one we can consider also, the Chinese traditional medicine. We can be traced to the Shang dynasty. So it's a lot older because it's not 4th century BC, but 2 millennium BC. So it's 2nd millennium BC. So it's a lot older. So, of course, as I said, there are other local medical philosophies. You have shamanism in different parts, etc. But these three had a big influence in different parts of the world. But we are dealing here with three different concepts. In the Western medicine, following Hippocrates, a disease is an imbalance. Okay, but the key point with the Hippocrates philosophy is that, and that shaped the whole Western medicine philosophy. The point is that the approach is syndromic. It means that we start from the disease. Okay, so there is no prevention in this approach. First, we see the disease, and the role of the doctor, the role of the physician is to cure the disease for the good of the patient. Okay, is not to prevent the disease from appearing, is to cure the patient. And for that, it relies a lot on drugs, technology, today on drug synthesis, etc. Then, if we look at the Ayurvedic approach in India, it's a lot more holistic. The Ayurvedic philosophy is a holistic philosophy. Okay? Diseases can be prevented. So in that case, it's no longer curing the disease after it appears. It's trying to prevent a disease by a good hygiene of life, a good balance. Okay, they also recognize the disease in balance, and Ayurveda is meant to keep the balance. To prevent the appearance of diseases. Of course, it's not always possible, and they also have treatments, including in the Ayurvedic approach. However, they are all from natural origin. They don't rely on synthetic drugs like the Western medicine. So it's a more holistic and nature-oriented philosophical approach. Then, if we look at the Chinese traditional medicine, it's a blend of different things, holistic and the drugs. Diseases are both prevented by a good hygiene of life, but there is a large pharmacopoeia of natural products in the Chinese traditional medicines. Some working, other being more on the I would say, fantasy side, but a lot of superstition as well. It's a blend of different things. But it's kind of holistic approach also. Now, because Professor Tree at the beginning asked me to cover the French or the Western culture in surveillance and screening and prevention of diseases and of course infectious diseases. I'm going to focus really on this Western medicine and on the syndromic approach. Okay. And what happens? Because today worldwide, Western medicine has really taken over because of its connection to modern pharmacology, to technology, and to synthetic drugs. So it's very efficient for that, and it took over. Also, why did it take over? Also, is that first reason is a major one, but it's not the only one. It's also because it corresponds to the philosophy of WHO. Because WHO is based on the Western medical approach, and of course, therefore, it influences all international agreements and all governments, even those who are not Western societies, will apply WHO recommendation and therefore Western medicine philosophy. Okay, so doing so, the syndromic approach has been institutionalized and internationalized through this channel. However, good, but first question to ask, what is this syndromic approach I am talking about? Okay, so to do that, I should ask ourselves some question. What is a disease? First question, we're talking about disease, infectious disease, emerging disease. What is a disease? A disease is a pathologic, physiologically abnormal condition. It's a deviation from a normal, so in other words, a healthy condition. Okay, but how do we define a disease? That's a key point. Yeah? We have a dual definition for a disease. Disease means first the fact of not feeling well. That's what it means. That's actually the meaning of the word disease. Disease means this is not at ease. And in many languages, in French, in Latin, in many languages, is exactly the same thing. We refer to the state of but not feeling well. Okay? The other definition is what? Is the name given to a pattern of descriptors corresponding to this state of not feeling well. Okay, so therefore, it's the name given to a pattern of symptoms, and the pattern of symptoms is the syndrome. Okay, with no clear pattern of symptoms, the disease cannot be identified, cannot be diagnosed, which is the starting point in the Western philosophy. First, we start by identifying the disease. If not, the physician can do nothing. And that's why the medicine is syndromic by essence. Everything starts with the capacity of identifying the syndrome, a set of symptoms. So now let's ask, okay, what is then an infectious disease? No longer a disease, but an infectious disease, because that's what we are talking about. An infectious disease is an abnormal physiological condition of a living organism resulting from the normal life cycle of another living organism. We are no longer in the same context here. Okay? When we consider an infectious disease, there is an ecological dimension, because an infectious disease results from the interaction between two different species. Okay, the disease is caused by another living organism, and each living organism is impacting its environment. Each living organism is true for us, it's true for everybody, for all organisms, is altering its environment just by living. Okay. However, the environment of a parasite or pathogen is another living organism. So the parasite or the pathogen will alter, will impact the host. Okay, and this damages at what we call symptoms, and the effect is what we call the disease. So you see, when we start talking about infectious disease, we start leaving the field of medicine to enter another field. We are the border between different fields, and we enter the field of ecology. It's not the rules that will apply are for a good part ecological rules, and we will see later, not only. Okay, what is an emerging infectious disease? It's very simple. It's the definition of the word emergent. Emergent is something which was not previously visible and then becomes visible. The best example is a reef at sea. When you have a high tide, you don't see anything. You don't see the reef. You don't see the danger. And at low tide, the water goes down and the reef is showing up. And then you realize the danger because you see the rocks. But the reef didn't appear by magic. It was already here, but it was not visible. Okay? Is the same thing, the same dynamic with emerging infectious diseases. The pathogen is here. It is present. But it didn't trigger a disease. The disease was not previously visible. So what is emerging is the visibility of the disease, not the presence of the microorganism. The microorganism is already here. So let's consider again, what is an infectious disease? And let's take a very theoretical case, okay? In all infectious diseases, a large part, sometimes the main part of the population is what we call asymptomatic. Asymptomatic means no symptoms. So basically, considering the definition of the disease, these people are not diseased. They are not sick because they have no symptom. So not sick, not disease. However, they are infected. So infection, but no disease. That's the asymptomatic. Okay? Only a small or bigger percentage of the population will be symptomatic. So diseased, sick. But they are sick because of their physiological condition, because of that weakness. Okay? And it is really a matter of statistic, a matter of a number. Okay, and a matter of transmissibility of the microorganism. If a microorganism is highly transmissible, then a higher number of people will be infected, and statistically, a higher number of people will be sick, and the disease will become visible. That's what we call an epidemic. So let's take two examples. Let's take a first example, and we say that, for instance, 90% of the population is asymptomatic, so no symptom, not diseased, and 10% of the population is symptomatic, but everybody is infected, huh? But 90% doesn't show any symptom. But, sorry, the microorganism is not very efficient. It's not very transmissible. It is purely transmissible. Therefore, therefore the number of people being infected is quite low. So let's say that altogether this microorganism is capable of infecting about 100 people because it's very poorly transmissible. 10% of 100 people is 10. 10 But 10 people showing symptoms, we don't see it. Because it's not visible, because the disease can be confused with another one. It will be atypical, will be something like influenza-like, pneumonia-like, whatever-like, and it's not clearly visible. Though the disease is not characterized, we don't see the disease. Now let's take another example. Still the same thing, the whole population is infected, 90% asymptomatic, 10% symptomatic, but this time the pathogen is very transmissible. It can easily infect other people. And this time, instead of infected 100 people, it infects 100,000 people. 10% of 100,000 is 10,000. 10,000 is a lot of people. 10,000 people being sick, you see it. All of a sudden, the disease becomes visible. An epidemic becomes visible, and the disease is characterized. And then we see the emergence of the disease. This is exactly what happened in Wuhan at the end of 2019. Okay? Of course, it's a theoretical case, actually, here, because the higher the transmissibility, the higher the percentage of symptomatics. But what is important to realize is that an infectious disease is just an epiphenomenon of the population dynamic of the microorganism. I see something in the chat. What's anything important? No. An infectious disease is an epiphenomenon of the population dynamic of the microorganisms. It is the visualization of the incapacity of part of the population to resist the damages resulting from the life cycle of the virus, for instance. Okay? The key factor is the R naught, the transmissibility. The higher the transmissibility, the higher the number of people infected, the higher the visibility of the disease. Because statistically, more people will be infected, and there are more weaker people will be infected and will show symptoms. Okay. Now we are starting to enter a specific point related to the culture, and you will see that the words we are using are shaping our way of thinking. Keep that in mind. And the way we represent our perception of the biological reality. We never work on the biological reality. It's too complex. We work with our representation of the biological reality. And this representation is biased because words, concept, and representation are cultural. So from now on, what I'm going to say, keep in mind that things are biased because of that. And then we have a different of perception. I told you, human medicine is syndromic. Veterinary medicine is syndromic as well, because the disease is the starting point, is what we saw with the Western medicine philosophy. If we consider another field of pathology, which is the plant pathology, not human or veterinary medicine, the approach is completely different. Why? Because people can associate to human, of course, associate even to animals because they're close. They will never associate to plants. So plant is far distant and people don't see it the same way. And in plant pathology, a disease is not syndromic, is ecosystemic. In plant pathology, the disease is not the beginning, it is the end of the process. It is an ecological process and interaction between different species. And the disease we see on the plant is the visible effect of populations interaction. It's the concept of pathosystem, an ecosystem involving parasitism. This is true in plant pathology, but not in human in veterinary medicine because of the bias we have, okay? And the bias for us is what we call anthropocentrism or observer bias. We can go back in physics to the Copernican revolution. It applied to biology as well. Before Galileo and Copernicus, we had what we call the Aristoteles universe. And in which people consider that everything was geocentered. So the whole universe was revolving around the Earth. Why? Simply because every morning people were seeing the sun rising in the east. At noon, it was above the head, and the evening, it was setting in the west, and that every day. So, but every day I see the sun going from east to west, but the logical conclusion is that the sun is revolving around me, around the earth. That's an observer bias because what Galileo first and Copernicus also showed that is just a bias and just a misconception based on the relative movement of the different planets and stars, etc. Actually, in our system, everything is heliocentered, centered around the sun, not the earth. Okay? But it's just biased perception. And in biology is the very same. Biology is the very same. We see that later. We are centered not on the earth, but centered on us as humans. And it comes from our culture, from our philosophy, also from our religion. In many religions, true in Christianity, true in Islam, for instance, God created man to his image. So people see it's in our culture. We, even you want it or not, it is embedded in us. We see ourselves as something special. And so we are not part of the whole world. We are above the whole world. And whenever there is a disease, the disease are coming to us. We are the victim of an evil world beside us. And the infectious disease coming to us from an evil through different ways, and we invent any kind of story to describe that. And simply because medicine is anthropocentric, based, centered on human, whereas plant pathology is not. Is not anthropocentric, so it has a more logical approach. Oops. Okay. Actually, what happens with viruses and pathogens, not only viruses, is that it's not a movement from animals to humans. It's a general circulation, general mobility of viruses and other microorganisms with interaction between different species, and the different species are hosts, animal hosts. Humans is just another animal species, and you have a circulation in all directions, from let's say animal to animal, animal to human, human to animal, because anyway it comes to all animal species. So at one time there will be one animal-human interface. We will be interested in that. Okay, so we have a general introduction. We are not independent from the rest of the living world. We are part of it. So let's go back to the disease. I say who are the disease, the people. The disease, the patients are people unable to resist the damages done by the microorganism. Just like it was described in plant pathology. Why? Because they are too weak. Why are they weak? Because of age, comorbidities, other infection, genetic background, for different reasons. And for different reasons, they cannot resist, and they will show symptoms. But the symptoms depend on the individual patient. That's why there is not one single symptom. For a disease, you always see a pattern of symptoms. A disease is not uniform. So the key issue now to consider for the rest of the talk is that a disease is not a tangible biological entity. A disease does not exist per se. A disease does not have any physical reality. A disease is a reaction to something. It is a reaction of some people to the life cycle of a pathogen. Okay? And therefore, it is not the beginning. It is the end. It is ecosystemic. It is the consequence of interaction of different species. That's why we have to be very careful, because words are shaping the way we think. Transmissible disease is a completely misleading concept. A disease cannot be transmitted because a disease does not exist. A disease is a reaction to something. Okay? Infectious disease is a correct concept, because it's a disease caused by the life cycle of the pathogen, the pathosystem. And what is transmissible is not the disease. What is transmissible is the microorganisms, which will or will not trigger a disease. Okay? What are the consequences on surveillance and early warning? Because that is the topic of this presentation. Following the Western medicine, which has really taken over, but we are on a syndromic approach. We always start with the disease. Everything starts when the disease is characterized. And the objective is to find a cure to the disease or a vaccine. That's the Western medicine, that's the Hippocrates approach. WHO is part of the Western perception. Okay? We look at the WHO pandemic agreement, WHO Health for Pandemic and Epidemic Intelligence. It's very good. The objective is to develop a more effective disease surveillance worldwide, but a more effective disease surveillance. The key point is disease surveillance. But when the disease is characterized, what do we do then? We are looking for the origin. Another bias. We are going to see that. It's exactly what WHO did in Wuhan with COVID-19. The disease was described in Wuhan. They sent a team to Wuhan to find the origin. We saw recently antivirus problem on the boat, and what they did, they sent an investigation team to Ushuaia to look for the antivirus. Automatically, they search for the origin, which is another big mistake. Why? because it's simply the wrong software, the wrong way of thinking. Why? Because we are prisoners of our culture and our words. The culture, even the religious tradition are shaping our way of thinking, okay? This has two main consequences. The first one is the information and starting with the disease. No matter how fast the information can go, no matter how efficient you are in getting all the data, when the new viral disease is visible, it is too late. Because the disease is the end of the process. This is not the beginning. Okay? When we see the disease, the virus is already everywhere. Okay? Nowhere no, we should not try to the sentence is bad. We don't try to prevent the dissemination. It is already, no need to try to prevent the dissemination. It is already disseminated, okay? And the second bias is that we are looking for the origin, but there is no origin. The West is culturally conditioned to search for Adam, for the first man, you know. We are looking always for the first of everything. So this is very pregnant in the I would say, the Judeo-Christian tradition, but also in the Islamic tradition. We are looking for the first one, for Adam, but there is no first one. It does not exist. There is no first one. And there is just a dynamic mobility of things. And therefore, we are searching for the famous spillover. But there is absolutely, it's an idea, it's a myth, it's just an invention. There is no, absolutely zero demonstrated mechanism of spillover in the literature. It is an intellectual construction, an idea, an invention, an abstraction, but with no basis. But nevertheless, we work on that because it is our tradition and our way to think. And we are wasting a lot of effort with that. The point is, we cannot detect a new causative agent before the disease is described. Why? Because you cannot detect something you don't know. You should know it before. And when the disease is described, it is too late. So we have a problem here. And the emergence of a disease is the result of the stochastic combination of multiple factors, out of which many are unknown. We don't know what is involved. And emergence of a disease is an accident, is the definition of an accident, okay? And like with any accident, we can only analyze the causes, try to understand what happened, analyze the chain of events, and see why the accident happened, understand everything. We can do that. But we can do that only retrospectively, after it happened, not before. And it is an accident, so stochastic by nature. So the same chain of event will not reiterate, will not happen again. There will be other accident, but the next accident will be different. So trying to block everything exactly the way the first accident happened, it will basically be futile because the next accident will be different. It will not follow the same path. Okay? So the real situation is we cannot predict anything. And we don't know what the next one will be. That's where we stand. So what can we do at that stand? But all we can do, to speak the truth, is to be as ready as possible. But what does it mean? have as many intensive care units contained for microbiological safety as ready. We can use them as really regular bed, but they are ready if needed. And more important, because it takes many years, it takes a long time, we must have ICU training being mandatory for all medical staff, physician, nurse, everybody. Okay, they must be trained in ICU, and they must be trained also in a yearly basis. Building a ICU room is fast and it takes money. That's it. Training the personnel takes years. So we need to include that in the medical track and have the people ready. It's just like a military service. Okay. So what to do also when it comes to the origin of the pathogen we are looking for? But as I said, there is no origin. There is a permanent circulation and evolution of microorganisms in different compatible hosts. They move from one host to another and they use the host for contacts and that's it. Okay? And these are not always pathogen. Even in the same host species, take one virus. If the host is sick, then it is a pathogen because it's triggering a disease. But if the virus is present in an asymptomatic person, no disease, then it is not a pathogen because it does not create a disease, but it's still the same host, it's still the same microorganism, but the status is different. Okay? So it's also something very subjective. And there is absolutely no way to identify ahead a human pathogen. Why? Is that the reason is that we cannot identify human pathogen in the wild, and that's what you try to do. We are screening in the wild, in bats, in whatever, to get the human virus, and until now we got zero. Why? Because a human pathogen has evolved and adapted in human. The human pathogen is the human avatar of a greater metapopulation. It's something typical to human that has evolved in human and exists only in humans. In another species, you will have a related virus, but not the same. And that's what we find. We find related viruses. We find cousins, never the same. If it is in other species, it will be related. It will be the avatar of this species. And that's it, because they evolve in each different species. The best demonstration is given by SARS-CoV-2. We all know SARS-CoV-2 and COVID-19. How does SARS-CoV-2 evolve? Now we have been described this since 2020. It's evolving through a succession of transient variants. Okay, one variant shows up and disappears. And each variant in the progeny, one variant in the progeny overcomes the parent because it is more adaptive and replace the parental population. And the parental variant then disappears. Today you will never find any Wuhan 1 or alpha or beta variant. They don't exist anymore. They exist only in computers and lab collection. They don't exist anymore in the nature. They appeared, they were present, they gave a progeny, and then they disappeared. Okay? And what happens today, you see, it's we can see differently, see the different virus, or see with the population of the different variants. And what can we do today? Today, COVID-19. Okay, SARS-CoV-2. We have tens of thousands of sequences, even if not more. Okay, we have a permanent monitoring. It's the most studied virus ever in the whole history. Okay, it's sequenced, it's monitored, it's characterized, it's looked after all the time, and only thing we can do only thing we can do is look at the size of the population of the given variant and see if it reaches a certain level, but we call it VOI, vector of variant of interest. If it goes a bit higher, but we call it variant of concern. And if the population goes even higher, then we call it a new variant and we give it a number, etc. And we can do that only retrospectively after it happened. So we have a virus. We know its completely sequence monitors is the best known worldwide, and it's just impossible to predict when we look at it every day. So how can we predict anything on an unknown virus? Impossible. Just impossible. Furthermore, as I told you, viruses are evolving by a succession of variants which disappear. So if you go in the wild and you do screening, a lot of people are doing that. We waste a huge amount of money on that. Okay, but you go, you identify a virus. Okay, but they will disappear, just like they do here. And if you go back 1 year later, maybe 2 years later, you get the same sample from the same animal, you will not find the same virus. So we are trying to predict things. On things we are transient, we have a limit of lifespan, and we don't know what will happen in the future. It's totally impossible. It's science fiction. Okay, we cannot predict anything. We can predict nothing. Nothing can be predictable. So why all these failures? Why we cannot? Why? Because it is not a medical issue. All medical philosophies and cultural aspects in medicine are totally inadapted because it's an ecological and societal issue. It is not a medical issue. Okay? The cause of the disease is biological, is the pathogen. Okay? But the cause of the emergence of the disease is societal, is the human society. What to do then? But we should target the nodes and try to work on that. And we can try to target the amplification loop where the virus is amplified in the human population, but it's difficult because poorly accepted and with a high societal impact. What happens is when the virus is evolving in the human population, the human avatar, at one time, the population of the virus may be amplified, like in the boat with the antivirus or the market for COVID or other things. You need to have a lot of people at the same place at the same time for the virus population to increase quickly. Then they will reach the outbreak threshold, and then it will be able to start the epidemic. So we could try to break this, but it means breaking and disturbing the societal life. It's very badly perceived and accepted. So we could do it, but it's not easy to do. Okay, so what to do then? Well, still targeting the keynotes, we should target, and in my opinion, is the best way of action, is we target the interface between humans and animals when the virus or the other pathogen comes from a human species to from animal species to humans. I'm sorry. And this happens not in downtown. This happens in rural areas, suburbs, farms, where animals live in humans' habitat. Why? Animals go to human habitats. Why? Because they find food, safety, shelter. And then there is a permanent or frequent contact, and then statistically a higher risk for transmission. So we don't need to screen viruses or other microorganisms in the wild. We don't even need to know them. Only we need to organize the human habitat to avoid permanent installation and contact. This is not a medical issue. This is a societal issue. It's a blend of ecological and a societal issue. We can, the place where we can do something is here at the primo-infection, the primary case, when the first human is infected by something circulating in the wild. That we can do because this infection will occur because of the way it is organized. And since it is a societal organization, it's based on human rules. We can do nothing about ecology, about evolution, whatever. We can do a lot about human rules because we make the rules. It's just a matter of targeting the right thing and moving away from our medical philosophy. And to conclude, I will just ask you a question. Doing that, what is it if not One Health? Doing that is exactly One Health is, working at the interface between human, medicine, ecology, environment, society. That's the very definition of One Health. My time is over, and I thank you for your attention. I saw a question in the chat.
Or maybe we can read the question on chat. Or maybe on site participant, if you have any questions.
I saw two questions in the chat. If you agree, we can start with that. Okay, so first question in the chat is, my name is Aurori Esther Younes from Makerere University College of Veterinary Medicine. I have a question. If an infection disease, voilà, you have it on screen.
Okay. Yeah, it's already on the screen.
If an infectious disease has a higher R naught, and yet most of the population is asymptomatic, how best we protect public from being infected if the disease is emerging? But you cannot. Because it's a matter of population dynamic. If the population dynamic is very important, you cannot protect because the infection is here. Infection and disease are two different dynamics. However, we have a very good example of that. A very good example of that is, if we remember well, is the 2009 H1N1 flu pandemic. And this virus was extremely transmissible. And basically everybody worldwide got contaminated very quickly. So it's the case where the R naught was very high and the virus moved very quickly. However, basically nobody got sick. Very little, small number of cases worldwide. Why? Because the virus was very transmissible, okay? But it was not very virulent. It was not very pathogenic. So people got the virus, but nothing else happened. So in that case, you cannot protect people from getting infected because the capacity of being infected is direct consequences of the R naught. So there's nothing to do about it. By the time you realize the virus is here, it's already infected everybody. So it's too late. However, there is a little chance that something happens, except maybe a mutation. Why not? It could happen. It could happen. It could happen. Anything could happen. But in the initial state, there is low chance of targeting a disease because it's a virus which is not very pathogenic, very virulent. However, it can mutate and later on give something a lot more pathogenic. It's exactly what happens in several cases. It could happen, but there is no way we can foresee that. No way. My name is Tolulope Sharon Umide. What surveillance strategies are most effective for detecting community transmission of emerging disease with a high basic reproduction number and many asymptomatic cases? So it's related maybe to the first question. Problem of surveillance is you can do surveillance only on what you already know. It is a virus or pathogen you know, but you can detect it. You have a tool, you have a molecular tools or whatever to detect, or ELISA, whatever, but you have a tool to detect it. If you don't know it, you have nothing. You don't know. You cannot detect something you don't know. So you cannot run surveillance on something you don't know. So in that case, that's what I said earlier, is you cannot do anything before the disease is described because you don't see it. You don't know what happens. So you have to wait for the disease to be described and then you can do something. You cannot detect the community transmission before the disease is described. If the disease is described and move quickly, then you have then you don't have many asymptomatic cases. You have enough symptomatic cases to trigger to find that there is a disease. If not, that is the case I described before. There is a lot of asymptomatic, but therefore no disease, no symptoms, so no problem actually. You just have an infection. You have to realize that in humans, for instance, and all animals, we have a lot of infection. We carry a lot of viruses in us. A healthy human carries a lot of viruses with no disease associated with it. We should completely separate infection and disease. We can be infected and have a lot of viruses in us, but no disease. It's two different things. Yeah? And Iran. Oh, thank you. Thank you, Mariam. It's really a population dynamic, and really don't associate the disease and the infection. It's two different dynamics and two different things. The infection, it's very difficult to do anything about it except what I said at the end, trying to work at the interface and prevent the virus, for instance, from moving from animal to human by organizing the human habitat, housing, and preventing animals from living with the human, etc. That we can do. Okay, but otherwise you cannot prevent any infection. It will happen one way or another. Okay. Then, but infection is one thing. A disease will develop because of the human society, the organization. An infectious disease will always emerge and will always spread 100% of the case. There is very, very few 100% things in biology, but in that case, there is one. In 100% of the case, infectious disease will propagate because of human activity. Whatever it is, business, whatever, it's because of human activity that the disease is spreading. So if we want to block the progression of the disease, is by focusing on the human activity and the organization of the human society. Again, I said it and I say it again. It is not a medical issue. It becomes a medical issue at the very, very end when the disease exists, and then the physician will come to help the patient and treat the patient. Okay? But that's the very, very, very end. Before that, it is not a medical issue. It's an ecological and societal issue, and we have to focus on that. I hope I answered your questions. Please, if you have any other question.
Okay, maybe from the side.
Hello, sir. My name is Juanisa. So yeah, I really enjoy the philosophical background and the thoughts of all of it. But as you know, we're living currently in this world, in this society at the moment. The way the world is being governed, like we're political beings, and it's always it's very driven with economy. And if we're just focusing on ecological and societal, what did you say before? On if we want to focus on that, it's not as interesting or intriguing in the political economical side. Do you understand what I
Question,
mean?
yes.
Yeah. So
It
how
is.
do
It
we?
is very complicated. Yes.
Yeah, how do we push it? How do we push this agenda that you said it is much better if you focus on, like handling the interfaces, like handling, say, deforestation, tackling all the things that you just mentioned, compared to just focusing on the medicine side of it. I hope everyone here understand what I mean, or you get my point. You see.
I would say I understand very well your problems. I have the same. Everybody has the same problem. It's extremely complicated because we are dealing with a multi-parameter thing, and in which it's science, okay? It's medicine, it's science, but it's also human. So it's also sociology and philosophy. And in that, we are dealing also with the belief of people with, it's very difficult to change traditions, to change what people believe. And it's very difficult to say, look, what you believe, it's okay, but it does not correspond to the biological reality. Okay? It's easy to say. I can say, okay, look, what you believe, well, it's not right. Biologically, it doesn't work like this. It's very easy to say, but it's extremely difficult to implement. Very difficult to tell to people, no, you have to change your mind and do differently. This is very difficult. Very difficult. And that's why I keep saying the problem is sociology. So we need sociologists, we need philosophers, we need religious people, because we need people who have an influence on the cultural part, on the behavior of the people, on their education, on their culture. We need to address that. It's not a physician, it's not a biologist who will be able to do it. A scientist, a biologist, a physician can bring data, can bring information and say, okay, look, it works like that. Okay, it's like this. Okay, technically it is like this. But to convince people to change their mind, it's a lot more complicated. It's a complete different issue. Actually, personally, working, for instance, on mosquito control or anything, my conclusion, for instance, is the case in Indonesia. I work a lot in Indonesia. My personal conclusion is that if we want to implement a good behavior in the population, in villages, etc. Okay, it is not through the administrative process. It is not through the medical process. It doesn't work. If we want to achieve that, we need to work with the religious authorities. Because whatever the religion, whether it is Christian, Muslim, Buddhist, Hinduist, doesn't matter. Whatever the religion, the religious authority have some not power, but some influence on people. And they can forward the message. And they can influence the culture and the people, and they can change things. So I know it was very difficult for you to articulate the answer. And it's very difficult for me to articulate the question, I'm sorry, and it's very difficult for me to articulate the answer because it's a very complex issue. and I really don't know nobody knows exactly how to do it. And that's what makes it also very interesting. Okay, but it's very interesting. It's a very important issue, very important endeavor, and something has to be targeted. But it's a very big thing.
Ask one more. Yeah, I understand
Please,
from the
please,
community
please.
part, but what about with the government, sir? Like, and how how like it's all based on capitalism, and it's probably also related, like how we see everything is like have to be economically, interest. Yeah. What do you
So,
think?
government side, we can say government with a capital G because it's true for all the countries. All countries, all governments is the same thing. Okay, there is no specific country in that. They all do the same. The point is that, well, governments, well, it's politics. In many countries, not all, but in most countries, these people are elected. So they need to be elected. So they need people to vote for them. They need to show they do something. Whether it works or not is not the main issue. What is important for them is not that it works or not, is to show that they do something. And how do they show they do something, something wise, something good, is by showing that they follow the procedures and they follow the international procedures, international agreement, and they apply the WHO recommendations. It is true in Indonesia, it is true everywhere. Governments or ministry will say, okay, this is the WHO recommendation, we implement it. If it works, fine. If it doesn't, that's my fault. It's the WHO recommendation.
Prof. Roger, maybe do we have any time? Okay.
Okay, thank you, Prof. Roger. My name is Risna, and my question might be related with the previous question. You said that before that to change a personality, a habit is not easy. You need to impose people from their head of religion and the other thing that will give them insight on how to approve the new law. But in my opinion, do you think that imposing the new law by the government itself to make the community they have to do the law itself, it's more effective rather than taking the longer path with like the head of the religion to influence their followers to do that? Because in Indonesia, back in 2020, when the COVID pandemic in here, the government imposing a law that people cannot go anywhere without wearing masks or without having vaccination, and make people doing it people start wearing masks, people start having getting vaccination, because they cannot go anywhere if they don't have that. But if we wait for the like head of the religion to like influence the people, it could take time. What do you think of that? Thank you.
I agree. It takes time. It takes time. It's not very fast. However, our experience in Indonesia and other countries, in many countries, is that when even if it is a good approach, let's say a good approach, something that will work, but if it is implemented from the administrative side with government agencies, etc., okay, most of the time, and look at you yourself, people around you, etc., okay. In that case, people will not trust the government action. People will not trust it. They say, what do they want? What are they going? What do they want? They are going to raise my taxes or what? Why do they want that? Why do they want this information? It's a matter of trust. It's really a matter of trust, of confidence. People have more confidence in person being part of their community than in people coming from the big city outside from the government to tell them what to do. They don't trust them. But that's true worldwide, everywhere on planet. It's a human, it's human behavior. They don't trust. They don't trust. So if we want things to be implemented, I agree with you. It's a longer path. It takes time. But what works is when it comes from the inside, from the community, and it's implemented, and it's become very strong, very solid. I have an example of that in Indonesia. You know probably the 3M approach for controlling mosquitoes, okay? The main advantage of 3M is that it works very well. Huh? The main problem of 3M is that it works very well. Why? Because people do it, it works very well, it's no problem. But since it works well, when people see it works, but they stop doing it. They see the mosquito, okay, they stop. And the government told us to do it. We did it. It's okay. Now we stop. We go back to our traditional way. And then, of course, the disease comes back. The problem of the 3M is not that it doesn't work. It works very well. It's the problem of sustainability. And sustainability will come only if it is embedded, integrated in the tradition, in the culture, etc. And that will not come from governmental directive guidelines. This will come from the inside, from the community itself. That's why I say we have to work with the community and with the religious authority, whatever the religion, does not matter, because these people are part of the community. That's why I said that.
Prof. Roger. Maybe we can have another one last question. Is there anyone who want to ask? Oh.
Hi, Professor. My name is Mudassar Asim. I'm from Pakistan. So you said like there should be involvement of different scholars from the different religion, and they should give some awareness. So let's suppose, as far as Islam is concerned, I read in the Quran that Allah has created solutions based on the diseases. So initially, the solutions created like this diagnosis, and then the diseases they are created. So how do you see, if I tell you that, okay, I know the problems, that it has solutions, but do you think, will you believe me or not? This is like the first part of the question. And second, like, okay, in Islam, like let's talk about general, not about the religion. So in general, people say like it is better to take care rather than depend on meditation. So do you think like if I say, okay, so Allah has created in Islam, like, Allah has created the solutions before the diseases, will you think, will you or people or like the society believe on us based in the same theory? Like it is contradict, it says like you should take care of your own. So what your thoughts on it?
Yeah. Okay, let's start with that. It's better to take care than to cure or give drugs or whatever. I fully agree. I fully agree. It's also the basis of Ayurveda. Is a basic basis of Ayurvedic medicine. However, it's completely true. However, you just go back to the beginning of my presentation. An infectious disease is not purely a medical issue. It's an ecological interaction between two different species. And that's what makes the difference. You can take care of yourself and people around you, and have a good balance, a good hygiene, and in your physiology, and that works very well. No problem with that. It works very well. And again, it's the basis of Ayurveda. So it's no problem. And but you said you're from Pakistan, right? Ayurveda is also very present in Pakistan. So, so it makes sense. However, in the case of infectious disease, it's a bit different because you are dealing with an enemy, somebody attacking you. So it doesn't matter how balanced you are being attacked. So the way of preventing is different. You have to prevent an attack. It is different. That's why I said we have to work on the interface. In working in interface is to prevent the attack. Rather than, of course, we may have later on to work on curing the disease. Okay, so there is a big difference between a problem of imbalance, physiological state, or physiological disease, where a good balance could help a lot, and the intervention of an outside element that will attack you. Of course, the interaction is completely different, and even if you are well balanced and take care, but you are attacked anyway. So the way to defend is different. And I forgot what was the first question.
The same. I got the answer. So it's like the creator who created the solution first, then diseases. It's like the main idea. But then
Yes.
simultaneously it comes, you need to take care of yourself. It's like the question.
Take care of yourself is essential.
Yeah.
It's absolutely essential. In terms of infectious disease, it's like two armies fighting, okay? So you have to prepare defenses in depth, distance from you, to prevent the other army from coming. That's why we have to move and work on the interface to prevent the contact. Because why the interface is very simple. The virus, the bacterium, whatever, the microorganism must move from one host to the other. You agree? There must be transmission. Okay? Okay, for the disease to happen, there must be first infection. For infection to happen, you must have transmission from one to the other. For transmission to happen, you must be at the same place at the same time. If we are far away or are not at the same time, then no transmission can happen. So we must be at the same place at the same time. Therefore, we must share the same habitat. And there is a probabilistic system. It does not happen just once like that. It's repeated, it's permanent contact of repeated contact because it doesn't work 100%. So, okay, there's a probability, probabilistic approach, okay, to that. So what we need to do is to break this contact. Organize things so that the contact does not happen. If the contact does not happen, but we don't need to know the virus or the bacterium, whatever, it doesn't matter. All we need to know is to make sure that there is no contact. But this is not medicine.
And you had another point that you said, like, is I mean, diseases and infection. These both are, different things,
Different
right?
things.
Okay, so like a recent pandemic, we call like coronavirus, and then people recommend, like they said, corona, like COVID diseases. So why they call the both, like we have corona and COVID, they are both same thing, like, and then they said corona is infection and then COVID is diseases. Why? And your
No,
point was totally
okay.
different thing.
Okay, let's go. The corona is a short for coronavirus. It's the family of virus. It's a family of virus. There are different viruses in coronavirus. You have, there are plenty. On humans, there are 7 coronaviruses that infected humans of different groups. Of course, COVID-19, SARS-CoV-2. But there is SARS-CoV, there is a MERS-CoV, for instance. They trigger different diseases, okay? They are different viruses, all from the same family, but different viruses. So corona is just a short for coronavirus. It's the family of virus. And SARS-CoV-2 is one group, specific group of virus. And COVID-19 is the name of the disease. Remember what I said at the beginning, the definition of a disease. A disease is 2 definitions, where first is the state of not feeling well. That's a disease, I don't feel well. And the second definition of the disease is a name we give to the set of symptoms. The name given to the specific set of symptoms described in Wuhan was COVID-19. 19 because 2019, and it's coronavirus disease 2019 up, and they named the disease. That's why I say a disease has no existence, no physical existence. A disease does not exist physically. A disease is just the reaction of people. Is the visualization of that's why we need to dissociate the infection and the disease. It's 2 different things, and the viruses can spread very quickly everywhere. It is not the Wuhan is the place where we saw the disease for the first time. Okay, because the conditions were good for the disease to show up. So we saw the disease in Wuhan and we classified it as COVID-19, blah, blah, blah. Okay. But Wuhan is the place of the first official index case. The index case is the first patient showing the symptoms. The disease is not necessarily the first people to have been infected. The infection may come from we don't know where, perhaps and even most likely outside China. But people got the sick, etc. But the conditions were not good in other places for the disease to show up. And these conditions were good in Wuhan. So the disease showed up in Wuhan, but that does not mean the virus is coming from Wuhan. The virus can come from we don't know where, and we don't know for how long. It's two different. You know, I have a very good example of that. It's still COVID-19. It was happened in the winter 2019-2020. Okay, there was an Englishman in Singapore. And this Englishman got infected in Singapore. He got infected by SARS-CoV-2 in Singapore. Okay. But he didn't develop the disease. He was asymptomatic. No disease.
Commenced in Wuhan. Then I guess it's
Yeah.
transferred.
No,
How?
it was later. It was later. So he got sick. He got sick. Why? No, he didn't. Sorry. He didn't get sick. He got infected. He got infected, but not sick. Well, then he went back to England. He spent time with his friends and family in England. He most likely infected other people around him and transmitted the virus, but nobody developed the disease, or at least there was no cluster, no visible cluster, no visible set of cases. Okay? Then it was winter, it was the ski season. So they said, oh, let's go ski. And because we have snow in the mountain, we go for skiing. So the whole group, including this Englishman, went to southern France, to the French Alps for skiing. They went to the ski resort. Okay, and the condition in the ski resorts are different because it's more people live closer to each other. It's cold outside, so they stay inside, etc., etc. And the conditions of life were different. And what happened? The same guy who got infected in Singapore with no disease went back to London, still with the virus, and didn't trigger any cluster whatever. When he went to the ski resort, boom, we got a cluster and a small epidemic. And it was the same guy already with the virus. And the epidemic started in the French Alps, but the virus was coming from Singapore. The guy got it in Singapore. So infection and disease are two different things. And what makes the disease showing up is the societal organization and societal environment. Two different dynamics, and we tend to mix both. WHO, the first one, when they see a disease somewhere, they go looking for the origin over there. Doesn't make sense. Actually, they found nothing. They went to Wuhan, they found what? Zero. Pressure.
Okay, thank you, Prof. Rutas. Maybe we already come into the end of this session. Maybe you can give a final sentence, maybe you want to highlight from the session. Just one sentence, maybe, Prof, that you want to highlight, maybe? Or
Sorry, what?
maybe you have a sentence to highlight today's session.
Oh, well, I don't know if you have any other question to ask. I would be happy to answer. Otherwise, I just want to thank you very much again for invitation, and thank you for the organizers, Prof. Tri, who invited me, all the organizers, May, who I interacted with for organizing this, and I want to thank you all for the opportunity to give this presentation. So thank you very much.
Thank you, Prof. Rutas. Maybe that's all
Thank
for
you
today's session.
to all. Terima
Afternoon.
kasih.
We can conclude that the dynamics of the surveillance is really complex, and we have to understand about the interface of the One Health approach. So maybe that's all for me. Thank you for your engaging participation, and I would like to take it back to the MC.
Okay. Thank you, Dr. Farida. Let us give a big round of applause to all of the speakers and also our moderators for today's session from morning to this evening almost. So before we end, I would like to invite Dr. Farida because we want to give our appreciation. And for Dr. Edwin, please. Thank you, Dr. Farida and Dr. Edwin. So, everyone, now we have reached the end of day 2. Maybe you can give a slight tap on the shoulder of your friends, left and right friends. Good job, everyone. So, I want to give you 2 announcements before we close this course, day 2 course. The first announcement, it's about ELOC platform. So in this ELOC platform, there are your assignment to complete, and the completion of your assignment and the presence form will be your guarantee to get the certificate and academic transcript at the end of the summer course program. So please make sure that you have completed all those requirements. And for those who maybe still have trouble in joining ELOC platform, you can still ask the committee as we can solve your issue. And the second announcement is about tomorrow, day 3. We shift our lens to the environment. We'll talk about water, waste, pollution, and preparedness. And tomorrow also will be our last day to learn in this room. As on Thursday and Friday, we'll go for a field trip. So cheer up, everyone. Tomorrow is the last day in this room. And for our field trip, there will be a group assignment. So please make sure to know who your group member from the program book. You can see it, the completed group member from the program book. So, and the last announcement, I think I have 3 announcements. After this session ends, you can still have a coffee break outside and enjoy the coffee break before you go home. So, thank you everyone for today active engagement. Have a good rest and see you tomorrow at 8:30 a.m. in this room again. Good evening, everyone. Have a way back on your what am I saying? Have a safe way on your back. Have a safe trip on your way back. Thank you, everyone.